Doctors, when did a patient's lie nearly end up killing them? Middle-aged housewife comes to ED with episodes of headache and collapse, vacant episodes, usually early hours of the morning. Has the full workup with CT scans and lumbar punctures several times, always negative. It took several attendances before anyone asked her about recreational drugs. She was an unassuming suburban mum. Turns out she was into C in a big way, leading to reversible cerebral vasoconstriction. No more C equals no more headaches, and no lasting consequences luckily. Not a doctor, but I was in the ER once, separated from another patient by only a thin curtain. It was impossible to not overhear what was going on. She was an elderly woman who had taken an ambulance and due to feeling faint and said she had no other symptoms. Hours are going by. She gets up to use the washroom a couple times and makes small talk with her brother, sounding pretty woozy the whole time. Doctors keep checking on her. They draw blood and check her blood pressure. I think it was like remarkably low, but they aren't sure why. Cut to several hours later when a nurse notices there's some blood on the woman's bed. After some back and forth, she finally admits that she had been bleeding profusely from her rectum for weeks. The doctors gave her a hard time but got her out of there real fast. Yikes, booty blood is never a good sign. Paramedic here. One common one is when older guys are having chest pain and we want to give them nitroglycerine paste pills to help the chest pain. One thing that doesn't mix well is nitro and Viagra. It causes a blood pressure drop that can be really dangerous. We always ask and make it really clear that if we give the nitro and they are taking Viagra and similar meds that they could die. It usually takes 3 or 4 warnings in a row before the guy will admit it. Early on I made the mistake of trusting a guy after just a couple mentions of how dangerous it would be. I sprayed the nitro under his tongue and he said, "Does generic Viagra count?" Frick. At one point his BP wasn't even registering on the box cuff. It was bad. I thought I was going to get screamed at by my doctor, but he just laughed and said it was so common that he wasn't upset, and gave me a couple ideas on how to make it clear how dangerous it was to the patient. I work in outpatient surgical center. Lying to anesthesia can be really dangerous. I've had a person lie about not taking drugs and then react badly when given the anesthesia meds because they interacted. Fortunately for that patient, not nearly dying, but I will forever have it ingrained in my head, the anesthetist leaning over their head screaming, "What drugs did you take?" And to that I fortunately haven't seen serious event, but definitely has happened to our providers, and I've seen more mild versions. People eating, drinking before the anesthesia and then denying. Lucky for my patients they just have puked after waking up, so we know they had it but made it okay. The danger is you can puke during sedation and then get it in your lungs, called aspirating, and die from that. Could be really bad, but fortunately I personally haven't seen the worst yet, but I've heard plenty of stories of it. Not a doctor, but my sister's godfather was diabetic. He went to the ER because he had a really bad cold for like 2 weeks. He went in and they asked him if he was a diabetic, and for some reason he said no. Long story short, they gave him something that made his sugar levels go up and he went into a coma. He died about a month later because his organs shut down. A hypo can give him delirium, which may have caused him to say no. When patients lie and say they haven't eaten anything prior to elective surgery when they have. I caught a patient snaffling biscuits that her partner had brought in for her because we are so cruel to deny her food. People can die from aspirating stomach contents during a GA. I didn't drink or eat for like 8 hours because I might have surgery that day, didn't have it until 2 days later. I didn't drink or eat all day because I went surfing in the morning and broke my leg, and the people at the hospital didn't let me touch anything just in case. One of my relatives had a bad reaction to amoxicillin as a child. Puffy face, trouble breathing, emergency room visit bad. Fast forward 15 years, she's off at college and has come down with some sort of infection. She, however, didn't inform the campus health people because, and I quote, "allergies are caused by a bad diet, and since I'm a vegetarian I shouldn't have them anymore." Yep, they prescribed her amoxicillin, and, if it weren't for her roommate being home to call an ambulance, she'd have been dead. Well, at least that wasn't a lie, just freaking stupid. I wasn't the lead on this case, but I was the assist. When I was in dental school, this patient came in and was really hyped up. My buddy asked him if he has been on any drugs and the guy just said he had a lot of caffeine. Okay, we move forward. From what my friend told me, his blood pressure was high, but not too high for an elective procedure. Part of the local numbing we give patients has epinephrine in it, and sometimes this gets into the bloodstream with certain types of nerve blocks. Not uncommon. However, if you've snorted a couple lines of C and then get EP in your bloodstream, that's no bueno. Ended up calling the ambulance. His BP was so high he was at risk for a stroke. So yeah, even stuff the dentist does can kill you if you lie. Every dentist's office I've been in as an adult has had a poster on the wall in the waiting room warning about this exact same thing. Here's a fricked up family story. We had an 81-year-old frail grandmother brought in by family for failure to thrive in the setting of incurable stage IV colon cancer being cared for at home. Patient was admitted awake and conversational. Poor historian. Complaining of pain. She proceeded to gradually get sicker, shut down like she was dying, becoming gradually non-verbal, unresponsive, and dropping vitals. She was DNR, so we did supportive care and looked for causes such as UT, SBP, sepsis, liver failure, etc. The family was around the whole time, acting very involved and caring. 36 hours later she gradually started coming out of it, before recovering back to baseline. It turns out she was given her home dose of morphine in the year prior to admission, which was 100 mg extended release morphine, twice daily, as she had been complaining of pain. Her family had failed to mention that they'd been diverting all her pain medications. That nearly got their grandmother killed, as we had no reason to suspect an opiate as the cause. That reminded me to always consider opiates. We discharged her to a long-term care facility. Not a doctor but an army combat medic. We were in a small firefight and a soldier was hit in the leg. It was very easy to see the wound because of the desert camo doesn't blend in well with blood. The part that almost killed him is he never told us that he was hit in the chest. We asked him and he said only in the leg. I knew he was lying because he was holding his chest too. But I didn't want to make a bad situation even worse, so I didn't say anything. But when we asked him again and he said no, I didn't want him to die of course, so I pulled his plate carrier off and we did more medical on him. He definitely would have died from that wound. It punctured his lung and he was having trouble breathing. We called for a medevac and he lived but with only one lung. Never knew it. He joined the ALA again but I assumed he stayed out. A lot of them I get. This one, no way. I guess it is the stress from combat because I can see no way how a sane person could believe this lie would somehow help him. I see he might have wanted to stay in combat, but still it's your chest. There's quite a bit of things you need in there. I work in an STD clinic, so the stuff I deal with isn't usually deadly or at least not immediately deadly. However, I am constantly surprised by the percentage of patients who test positive and refuse to tell their partners. A guy came in a few years ago who for something relatively simple like gonorrhea, but seemed to have trouble walking. Long story short, a nurse called an ambulance for him and sent him to the ER for a spinal tap. Turns out an ex-boyfriend refused to tell him about his syphilis diagnosis after they had a rough breakup like 15-20 years earlier. So not only was our guy possibly spreading syphilis unknowingly, he now had untreatable neurosyphilis. He worked with our disease intervention specialists to track down as many partners as they could, but I think he died from related complications like a year after his initial visit. That's just heartbreaking. We had a patient that took her home heart meds religiously even in the hospital when we were also administering them to her. She was educated to not take any of her home meds while she is hospitalized since we're giving her the hospital meds. She would sneak and take them. Her blood pressure bottomed out and would have to bolus her. Security was called and had to remove the meds from her and lock them up. We had another patient requested a sleep med. The nurse gave it to her. Later, found patient barely arousable and blood pressure dropped, which did not make sense. She was given a low dose of sleep aid. Patient had her purse open on the bed and found a prescription of Ambien. The patient took our sleep aid plus double dose of her home med Ambien. We always instruct patients on admission not to take their home meds while in the hospital. We are not allowed to go through their belongings due to privacy. Edit. Grammar. My, well, step-uncle. Brother of my stepfather. Never met him though. Lied about being in pain sick so he could stay home from school and miss a test. Kept upping the ante so they'd believe him. Apparently his parents were pretty strict and he was terrified to admit he'd lied. Long story short, they took him to the hospital. He was diagnosed with appendicitis, and they straight up cut him open. The test was looking pretty good at that point. It was pink and perfect, and I dropped it in the scrap bucket. I was admitting patients in the psychiatric ward. Busy night, and I was way behind. An older man with schizoaffective disorder is admitted with a caretaker. A nurse asks them a few questions, including if the patient has taken any medicine and/or narcotics. The caretaker says no. I see the patient 4 hours later. He seems delirious, which often is caused by a somatic problem, including medicine. You know where this is going. He can't maintain eye contact and can only sit in his chair and talk nonsense. He drools and yells every word, but somehow seems very tired. I ask the caretaker if the patient has taken any medication, and she says the patient broke into a medicine room at the institution he lives in, just started eating random pills. Apparently this is somewhere around 80 pills, not being more precise because she did not bother gathering the empty pill boxes. The only information I could get was that he definitely ate over 40 lithium pills, which is just great if you really hate your kidneys. Now, after calling the emergency department to quickly prep and an ambulance with an anesthesiologist for transport, I talked with the caretaker, through my teeth, just slightly angry. Apparently the nurse wouldn't understand because it wasn't his own medicine and she didn't want to make a fuss. I screamed into my pillow that night in pure frustration. I later found out he lived after intensive care and almost losing his kidney function. That caretaker deserved to lose her job, and probably some sort of legal criminal action. When someone in your care eats pills and you know about it and then tell a medical professional that they didn't, you are endangering the life of another human being. Don't freaking mess around with that crap. Had a grandma who was basically comatose status in her. Whenever we could rouse her or get a word she stated she wasn't on any drugs, we YOLO gave her Narcan, narcotic or drug, with no effect. 20-30 minutes later we do flumazanol romazicon, benzo or drug, and she wakes up. A lot of PPL weren't suspecting her of drug OD given her age and statement, so they were thinking 900 different routes. In programming we call that shotgun debugging. When we do our pre-op check before a surgery, our office prints out a list of meds we have in file that the patient is taking. We tell them please look at this list and sign it to indicate this is the current and up-to-date list of the meds you take. Patient signed and we plan for surgery next week. Get a call from anesthesia the day before her scheduled surgery. Apparently she forgot to mention she had started taking a weight loss drug that, if you're taking it, can cause severe hypotension when you go under anesthesia, and in extreme cases you can die from that. You have to have stopped the drug for at least 4 days to be safe to have anesthesia. So her surgery got pushed back a week. Not cancelled, just pushed back enough to be safe. She called our office fuming and demanding a refund for the time she took off work. Seriously lady? Sorry, but we have a signed document saying you told us all your meds. Exactly who should be mad at who? You put us at liability and now the surgeon our office doesn't get paid for that day when we could have subbed in someone else in that slot. My cousin isn't a doctor and sees this quite a bit. Mostly people lying about having done drugs and underage drinking because they don't want to get in trouble, not understanding that the doctors are less concerned with that than they are making sure the person lives. One particular incident, the person had drunk quite a bit and done several kinds of drugs but wouldn't admit to it, and came in alone, so there was no one to verify what had happened. Because this person wouldn't admit to the drugs they'd taken, and thus wouldn't tell the docs what they had taken, they had no way to help and could do little except watch as this person slowly died from the drug and alcohol interactions, because without knowing what was already in their system, giving them anything could have only sped up the process. The person was a minor and passed away from massive organ failure because they were more worried about getting in trouble than saving their own life until it was far too late to admit the truth. I was a L&D RN. My co-worker had a patient show up in labor. She was 6 centimeters. I was helping get the room set up for delivery, and the patient's mom started to ask her, "So does that mean the baby?" and the patient violently shushes her. Her doctor wasn't on that night and that office didn't have electronic records we could access at night, so we're just going about prepping for this delivery. When her doctor happened to come into the nurse's station because she had to come in for a medical patient on another unit, she just stopped by to chat, but noticed that patient on the board and asks, "Oh, so her baby actually flipped?" Turns out the kid had been breech all pregnancy and was still breech. She didn't want a C-section, so she figured she'd just try to come, and so far dilated that she could just deliver. That would have been okay if she was frank breech, but down, since it wasn't her first baby, but she was footling breech, crossed legs with feet down. That's dangerous as heck, because it's super easy for the umbilical cord to come out first instead of the baby, which cuts off baby's oxygen. My fourth was head down, and this ended up happening to me anyway. Emergency C-section in less than 10 minutes. Her baby was so lucky her water hadn't broken, especially if she'd been at home still. She still kept refusing the C-section, and my co-worker finally snapped. We had another patient who was in for a stillbirth and had a lot of family down in our waiting room trying to process what had happened. My co-worker asks if her patient had noticed all the crying people at the end of the hall as they were mourning their dead baby, and would she rather have a C-section or deal with the grief that family had. She finally got the stupid C-section. My co-worker caught a lot of flack for checking that patient and not noticing she wasn't feeling ahead. Not a doctor, but my dad's a paramedic. He's told me plenty of times about when patients have told him they've taken Ziz drugs when they've been doing illegal drugs to avoid getting into trouble, and he's administered drugs which just make it 10x worse because of the combination of them, and he can't do anything else other than just take them to the hospital if they're still breathing. The most frequent one is that they don't need a specific antibiotic or other life-saving drug because it is really just too expensive for them to afford. The fault is mostly with the drug companies. They find out they are the only ones making a specific drug and they raise the price just because they can. Then the insurance stops covering it, and the doctors may not learn any of this until the pharmacies start calling his office to get the drug changed to something else. But there is no telling how many people die or suffer serious health problems because of the drug and insurance companies' greed. A lot of people get less than ideal treatment simply because of these middlemen trying to get their cut. It may please you to know that in Canada, the government regulates how much a company can charge for medication. As a result, medicine prices are just 10% of what you would pay in the US, and in some cases just 1%. It is amazing what happens when the government is for the people instead of the corporations. I'm an NP and a medical IQ. Probably my most consistent is people lying about their drinking habits. I could give less than a crap if you pound a bottle a night. I just need to know so I can be ready for you to start detoxing on day 3 and have the right meds and cue so you don't have a seizure, aspirate, etc. I always make this abundantly clear, and I am not the morality police. Yet, every year we have a few come in with very fixable problems, lie about heavy drinking habits, and ultimately die in the hospital from complications secondary to their withdrawal. My teenage brother had the opposites to most of these stories. He came home after being out drinking with friends, raided the fridge and went to bed. A little later he comes out panicking to my parents that he's having trouble breathing, is feeling dizzy, and has a bunch of other alarming symptoms. They rush him to the ER, and from what they tell me the staff were yelling at him to tell them what drugs he'd taken, even though he was adamant he hadn't taken anything. They wouldn't believe him. My parents were begging him to tell them, but he insisted he hadn't. I'm not sure of the rest of the details, but it turns out he had developed a nut allergy he wasn't aware of and had eaten something that was causing him to go into anaphylaxis. Well dang, that was a huge stretch of the doctors to assume. Didn't even think to see what he had at least eaten before yelling at him, "What drugs did you take?" Social worker at a children's hospital. We have kids coming in through our resuscitation room that have been seizing and are unconscious with no prior history. I'm constantly trying to get parents to tell me if there is a possibility that their toddler might have ingested something. Does your kid have access to cannabis? Could they have eaten some? Parents never want to admit it to doctors, and so I'm always on a fact-finding mission. As a social worker, parents are either glad I'm there or they think I'm going to take their kids away. Cannabis can affect children in horrible, shut down your ability to breathe kind of ways. My 1-year-old niece died from cannabis. Poor thing had no chance to live. Not a doc, but worked in EMS for a handful of years. We would get overdose patients who definitely don't use drugs yet respond to Narcan. Had a relative that went in for surgery on his stomach. There were holes in the lining that were caused by painkiller abuse. No one at the time knew what was causing this except for my relative. Doc asks him if he was on any medications. Relative says no. They put him under. He didn't wake up. His toxicology showed oxycodone and hydrocodone. Don't lie to doctors. They don't tell anyone about your medical problems anyways. One of my patients was smoking in the bathroom while on oxygen. Could have ended very badly for him and others in the hospital. I'm not a doctor but a patient with a couple of really weird disorders that cause doctors who aren't familiar with them to think I am taking. I have been denied very needed basic treatment like a bag of saline because my dehydration is exasperating my symptoms because they think I'm somehow gaming the system. These assumptions that patients are lying do a lot of harm. 2. I have a story about someone's lie that did end up killing them. About 10 years ago my best friend's ex, David, bought some ecstasy for himself and his big brother, John. The ecstasy they bought was laced with something bad but they didn't know that yet. They each took one and John started to OD. David, wanting to save his big brother, called an ambulance. It showed up and David explained what happened. They loaded up John and they asked David if he also took the ecstasy. Because he didn't want to get in trouble he lied and said only his brother took the bad ecstasy. Ambulance left with John while David started to OD minutes later. John was taken to the hospital and survived. David died alone at their house. Such a dumb accident but so sad nonetheless. I think John still struggles with the guilt of the death of his baby brother to this day. How about the opposite? I've moved a lot and when I visit a new doctor they often try to answer my health history for me. Drinking, smoking, exercise and diet. Men, you're thin. So moderate. No. Regular. Healthy. None of that is accurate. But when I correct them I get oh. So is this a cry for help? What number? I just want you to have the facts. I'm not a doctor but my friend went to the dentist for an emergency root canal. The dentist asked him if he had done any kind of drugs in the last week because anesthesia they needed to put him under would kill him if he had done any form of C. He lied. The dentist was about to put him under when my friend finally came clean. My dumb butt friend nearly killed himself because he lied to a dentist. Jesus. Nurse here. We don't care. We don't care about your history, your finances, your social scene, your anything. We just want to help you. Christ. We really don't care about anything except that you are a human being, and we want to help you. Please people, tell the truth. It will save your life. Patients of Reddit, what happened when a doctor or nurse accused you of faking it when you were actually in need of urgent medical care? My friend's dad went to the ER and the doctor said he was fine after minimal examination. Her dad insisted something was wrong and said he wouldn't leave until they ran some tests. As he was being escorted out by security, he had a brain aneurysm and died. Her family was awarded a pretty massive malpractice settlement, but they were absolutely devastated. I fell down a flight of stairs one time while working, hit a nail on the way down and ripped my forearm open and was bleeding a good bit. Adrenaline had me going long enough for my girlfriend, a nurse at another hospital, to drive me there. I had a bloody paper towel on my arm and all the security guards and nurses assumed I was a junkie that blew a vein. Finally all the hype wore off and I kinda passed out and woke up in a wheelchair in the exam room. I don't know exactly what happened but my girlfriend was flipping crap on the workers. She said half of them assumed I was on drugs and the other half thought I was faking it to skip the line. I wasn't dying of blood loss or anything. I just got woozy when I actually was able to see the meat in my arm for the first time. They all just watched me as I fell to the floor and busted my head on the floor. Even then they didn't do anything. My girlfriend, who's not even half my size as I'm not a small guy at all, had to pick me up and drag me into the wheelchair. Frick that hospital. Yeah, my mom watched an old lady die from blood loss in an ER a couple decades ago. She just nodded off and collapsed and the nurses didn't do anything for hours. My mom tried to yell at them to do something but this was before she had learned English so nothing came of it. Not as a patient but as a parent of a patient. My wife and I started to suspect that something was wrong with our son starting at age 2. He would run around all day and was an active little guy but never sweat. He also never appeared to get cold. We live in New England and he would often take his shirt off before going to sleep even in the winter months. These concerns were dismissed as a toddler's or weird sort of thing by his doctor. We later noticed that he would stop and complain about his hands or feet hurting while playing or laying in bed. These were also dismissed. We were told that the pain in his feet could be because his feet are flat or because of growing pains. We were told that it could also be attention related. The doctor said that it's not uncommon for middle children to act out. This continued for 4 years. My sister is a biologist and asked us if we ever got him checked for Fabry disease. I flat out asked the doctor if he could be tested, and the doctor told us that there was no way this was Fabry and they weren't going to test a kid without any genetic history of the disorder. The disorder is genetic and without a classic sign. One that often doesn't show up until adulthood, if it shows up at all. We waited until our son was literally screaming in bed about his hands and feet feeling like they were on fire. We demanded to get him tested and he was diagnosed with Fabry. It's essentially a metabolic disorder caused by a missing enzyme. There are many issues associated with it, but the main one is extreme neuropathic pain in the hands and feet. The pain can be random, but with my son it is normally because he overheated since he lacks the ability to sweat. He plays sports, so we have to be careful. Overactivity and fevers have to be watched out for since his body can't cool itself down. Pain can last anywhere from a couple of minutes to a couple of days. The average age of diagnosis for this disorder is around 16, so it's not surprising that his doctor missed it. Most doctors do since it's a rare disorder. That was a little over a year ago and my son is doing well now. There is no cure, but treatment allows him to live a relatively normal life just with some added pain. I couldn't imagine making him wait until his teens to get any relief. I know someone with this. He borrowed my ex-husband's cooling vest from Glacier Tech, ex-Hazmes, some symptoms brought on by heat, last year to see if it helped and wound up ordering 2 for intense days. It might be worth a check. I was in labor and because it was my first, they acted like I had no idea what was happening and kept denying what I was insisting. I was over 2 months early and handled pain so well. They acted like it was just in my head. Made me stand at the counter filling out paperwork. While I insisted I needed to push, they decided to lay me down to check if I had even started dilating, and I promptly pushed him out. I was furious with how I was treated. I still am. Same here. Well, they wanted me to wait for the doctor. Finally I just started screaming and pushing. They all finally rushed in to help me. My mother had a stroke at age 32. The doctors didn't diagnose it properly for over 24 hours because they were convinced her symptoms must have been related to drugs since she was in good health and so young. My dad apparently tried to tell them that she has no history of drug use, but they didn't believe him. Now she's permanently disabled because of how long it took for her to receive proper treatment. Not me, but my mother. She had called an ambulance because she had been experiencing chest pains, to which they basically told her she was crazy. About a month later, she passed away from a heart attack. That sucks, especially since doctors consider chest pains an emergency. Sorry for your loss. When I was in labor, the hospital had my records wrong and showed I was due a month later. I was pissed, especially since I was in labor and in a lot of pain. The lady kept arguing until she realized I was in labor. She must have heard all the crap my boyfriend, now husband, we're talking about her. Because nobody has ever gone into early labor. Was 12 years old and had a heart problem that was just starting to show. Arrhythmia and palpitations. Only happened when overexerting myself. Go to cardiologist and was accused of faking it to get out of chores and soccer practice. By the time I'm 15, my heart is absolutely unreliable throughout the day. During an attack I would lose my sight and pass out. Same cardiologist still claimed I was faking it. Kids just don't have heart conditions. 16 years old and my heart finally stops. Luckily I passed out earlier at school and was in the nurse's office when my heart stopped after another episode. Woke up in the hospital, and BTW had a heart deformation that required surgery. My mother blew her lid, according my doctor of wanting to see me dead. Went to his office and threw his degrees and awards off his wall at him and was screaming at him. Only reason she didn't sue was to prevent assault charges. Simple echocardiograph showed growth causing the electricity to pump my heart to go in circles. It wasn't fun having heart attack simulations nearly every day for 4 years. Before anyone asks, was poor and that cardiologist was the only one on my mother's insurance. To my doctor's credit, we both kind of had a laugh at this one before the test results came back. I went to my primary because I'd been experiencing hot flashes. Doctor, Google couldn't tell me what was wrong, and I knew it didn't feel right. Well, at least we know it isn't menopause, my doctor joked. I laughed. What 23-year-old woman spontaneously goes through menopause? This one. My doctor was very apologetic. My mom went through full menopause at 36 and it turned out it was caused in part by Hashimoto's, which they also didn't know she had until she was in her 60s. I'm glad your doctor did tests and helped you. Changing it up just a little, my colleagues were convinced a girl was just faking a stomach ache. She was about 16 years old and it was exam season, a time when we would get many sudden tummy aches, fits, etc. So I understood their skepticism, but something didn't sit right with me. I took her history myself and sent her for an emergency ultrasound of her abdomen. Ectopic pregnancy. It was ready to rupture at any moment, so I shipped her over to Obs-Gyn to get surgery ASAP. She came out just fine, but man oh man did I give my co-workers a hard time after that. Exam season or not, we need to be thorough. Had another time when it was just me and one other doctor working admission. She dismissed a case of a little girl faking fatigue for attention. Thankfully I overheard her telling someone, so I went to double check. The poor girl was having a carpopedal spasm and was most definitely not faking her condition. He hooked her up to some calcium and sent her home with meds the next day. I'm not trying to make it sound like I am perfect, but in our line of work we must always be a little paranoid. Thank you for being conscientious, thorough, and taking your oath seriously. It truly is the difference between life and death. Not my child, my brother. He was 11 and suddenly tired and lethargic. He missed a lot of school. He hated missing school. My mom kept taking him in and they'd say it's the flu, or puberty, or mono, and it wouldn't ever get better. After a few weeks of this, my mom brought him to the hospital again and yelled at his doctors that something was seriously wrong with her son, and they needed to do their jobs and figure out what it was. It was leukemia. They called the next morning just before 2 AM and said the tests came back. Your son needs to come in now. Not in the morning, right now. I can't imagine what happens to a parent in that moment, when you know it's bad because they call you in at 2 AM, but you don't know why. He was in treatment for just over a year and was re-diagnosed on his birthday. A few months later, he had a bone marrow transplant and was able to come home pretty quickly. There were complications from the transplant, called graft versus host disease, like organ rejection. But the new cells try to reject you. It attacked his musculoskeletal system, causing stiffness and some dangerous situations. This October will be 8 years since the transplant, and he's cancer free. That boy loves to use the cancer card now, but he definitely earned the right. A doctor didn't believe me when I had a kidney stone that was too big to pass. He only changed his mind when another doctor checked me and started freaking out since I was getting super sick from the stuck stone. The doctor ended up getting fired from the hospital and my parents sued him. I wouldn't call it urgent medical care, but I was stuck in my room for about 5 hours on my bed with my head pressed into my shoulder because I had a pinched nerve. I had never had one before. I wasn't able to move my head at all, and when my mom got home from work she called an ambulance for me. They carried me out in a sitting position and off to the hospital we went. When we got there, it took about a half hour for me to get into the hospital bed, and ended up just giving up and leaving me sitting upright. The doctor pulled my mom out of the room and asked if I had a history of faking injuries in order to get painkillers, because I was pressing against the pain instead of leaning my head away from it. Whenever I get cluster headaches I find that counter pressure against the pain feels better than none. Had people questioning if I was really in pain or not. When I was 16, I was in a really dark place and one day I decided to confide to my doctor that I thought I might be depressed and see what he would recommended. Dude straight up laughed in my face and said, "You're not depressed, you're just a teenager." I told my mom I wanted to change doctors after that, and it took another year and tons of self-destructive behavior before I thought. Same thing happened to me. I begged for help at 15. Got told I was an overdramatic teenage girl that just wanted attention despite how intense my mood swings were and the suicide attempts. Never asked for help again until I had a 4-month depressive episode at 22. Turns out I'm bipolar too. This is not as serious or urgent a condition as the others, but it still manages to raise my blood pressure years later. Starting from when I was about 7, I would have terrible stomach pains, which my pediatrician claimed was attention-seeking behavior. He told my parents that they should punish me anytime I complained of stomach problems. My parents, who love yelling, jumped at a new reason to scream at me on a nearly daily basis. When I went to college, I was finally diagnosed as having a hiatal hernia, just like my grandparents, father, and aunt. When I was a kid, they even commented that I had the same symptoms they did, which for my pediatrician meant that I was just mimicking their complaints and didn't have the same condition. Because it had been untreated for so long, I now have to worry about Barrett's and esophageal cancer. Lucky me. New hearing doctor didn't believe that I needed hypoallergenic molds made and ended up making regular ones to try them out. Within a few days, my left ear was sore. It hurt a lot more than usual. Doctor and ear specialist thought it was just a little bit of irritation and that it would clear up quickly. It ended up being a major middle inner ear infection. Ruptured the eardrum. Pus and blood everywhere on my pillow. About a month of agony, a lot of drugs, and a lot of specialists in the hospital. I was already very hard of hearing. That crap made me lose another 10 dB permanently. This isn't so much a faking it situation, but more of my ex-girlfriend having to deal with a really incompetent security guard that hindered her getting medical help. My ex had a severe peanut allergy, and one time she ate a Thai chicken pizza in the college cafeteria that did not list peanuts as one of the ingredients. After her throat started burning, she knew something was wrong, so she grabbed a glass of milk, which I guess helped a bit, and went outside for some air, because she was having trouble breathing. A security guard was passing outside in front of the building and saw that she might need some help. At this point, my ex was panicking and frantically looking through her bag for her EpiPen. The security guard asked what was wrong, and she tried to explain that she had a severe peanut allergy and needed to be taken to the hospital. But when the security guard saw her take out the EpiPen, she took it from her and said that it was school policy that she be the one to do it. She then asked her to hold out her arm so she could inject her. My girlfriend could not believe that the security guard was trying to inject her arm like it was a flu shot, and out of frustration, she yanked it from the guard's hand and put it in her thigh, like you are supposed to, and sternly told her, "I need to get to a hospital now." For future notice to any allergy sufferers that have EpiPens, if anyone tries to take your EpiPen and play hero, kick them in the shin and do it yourself. Likely you have more experience and training with auto injectors than anyone else. When I was 9, I would get stomach aches when I went to school. My doctor insisted I was faking, but my mom insisted he take it seriously. Finally, they gave me a barium x-ray and saw I had a stomach ulcer. I had to take Maalox and drink milk at every meal and snack. I even had to get special permission to get milk from the cafeteria at morning recess. My teacher ridiculed me for that. She was horrible and abusive. While I never received any of her physical abuse, there were 2 other boys in my class who got it on a regular basis. This would have been 1980, so it wasn't normal for teachers to be pulling hair or knocking a kid's face into a desk. Every Friday, the 3 of us would have to stay after school while she told us all how stupid we were. My stomach aches did not get better, and the doctor accused me of some combination of faking, exaggerating, non-compliance. We literally had to save all the empty Maalox bottles to prove I really was taking my daily doses. Today we know that having me drink milk 6-7 times a day was exacerbating things. And in retrospect, my mom never really understood how stressful it was being in that class. It wasn't until the last few months of 4th grade, when they finally transferred me to another classroom, that I got well again. Later my mom told me that even she thought I'd been exaggerating when I talked about how mean the teacher was. Because I'd left the honors class, moved down a level. My former teacher still ridiculed me pretty frequently when we crossed paths, but it didn't tie my stomach up in knots. Not me, but my mother. She had been very sick and tired. Imagine a cold, but it's 100x worse. The doctor she saw multiple times kept basically blowing it off, saying she just needed some rest. It kept getting worse. One day I was home with her. She was in bed sleeping and I was out in the living room watching TV. For some reason, She decided to walk out into the living room and sit in the chair across from the couch. She looked like a legit zombie and when she sat down she could barely hold her head up. I immediately called 911. Turned out she had pneumonia and one of her lungs was entirely full of fluid, while the other was more than halfway. She spent a few days in the hospital and fully recovered. I don't know what made her decide to walk into the living room, but if she hadn't done that she likely would have died that day. All of that could have been avoided if the doctor she saw would have just paid closer attention to what was going on. Every time I've gone to her with anything, the first thing they do is a chest x-ray to check plus blood work to check everything else. In army training, going to sick call made you a shitbag and trying to get out of training. Even doctors kinda brush off people cause they see so many, some who are actually faking it. So when I went in with bad back pain, the medic clearing me brushed me off and told me to go back to my company. Turned out my kidney was severely infected. I can barely remember this, but I was around the age of 11. I went for a sore throat, severe cough that would make me dry heave, phlegm, just the whole thing. Doctor says it's all in my head, despite me having an obviously inflamed throat and a very wet cough. I remember sitting there with my grandma who was like, oh, I don't think it's in her head. I went back the same week and was diagnosed with walking pneumonia. I think that's when we switched doctors to LOL. I was 17 and had excruciating lower abdominal pain. Was sent home twice because I was young and it was probably just menstrual cramps. Third time I went to her, I happened to be on my period, so I told them I was also bleeding. Finally, the nurses passed me on to a doctor and gave me a scan ultrasound. Had an ovarian cyst the size of a golf ball. Ended up losing my ovary. I only have partial hearing in my left ear due to an idiot pediatrician. I was 15, I had an ear infection. Between dumb alcoholic mom swearing up and down that everything I did was for attention and this idiot who must have printed his diploma using Ms. Paint, I got no treatment. He didn't even look in my ear. It ruptured that night. Blood and pus everywhere over my pillow. A doc said I had the worst ear infection he'd ever seen. Broke my foot in 5 different places, but the scan only showed one little tear. They sent me home and were like, you will be back to normal in 6 weeks. 6 weeks later and my foot was still swollen and bruised and couldn't stand on it, so I went back. The doctor said, well, I can see on the old scan you had just one little tear. Maybe you need to try harder, but fine, we will do an MRI on your foot. Few days later I came back for the results. The doctor said, well, sometimes a regular scan can't see everything, and as we look at your foot here and here, you can see the broken bone fragments. It's already healing just fine, but this will take months to heal completely. No wonder you couldn't walk. I wasn't in that much pain, and if they saw the breaks at the scan I would have needed a cast for 6 weeks at least, so I don't really mind what happened. Not a doctor or nurse, but a bunch of camp counselors and the infirmity doc. I went to a sleepaway camp for children with cancer, anything chronic and or life-threatening. It's the second day and I wake up feeling a little bit sick with a sore throat. Okay, I'll just drink some water and I'll be okay. It's the summer after all. I can't get sick. Breakfast rolls around at 10 AM and I'm not hungry and my throat is getting worse. I tell one of my counselors that I'm not feeling good and he says, eat something. Wait till after the morning activity. I couldn't bring myself to swallow and just sit there and then go to arts and crafts. I feel so sick at this point I just sit in the corner of the arts and crafts room, literally fading in and out. I tell a different counselor and he says, drink some water. I do. It doesn't help at all. I realize that they're not going to do anything unless I make a big deal about it. I think to stand up and make an announcement. When I stand up I immediately need to sit down again and now my throat hurts too much to talk. A third counselor walks up to me and asked me how I'm doing. I say, I don't feel good in my raspy weak voice. He says, wait until after this activity. Lunch comes around at 12:30 and I go to the bathroom before sitting down and I look like a zombie in the bathroom mirror. I go back to my table and say I can't eat. The counselors ask why. I say, I fell sick. One of the counselors begrudgingly agrees to take me to the infirmity, which was a mini hospital because all the kids here had medical issues. I can barely walk but I make it there, and promptly get sat down on an old wood bench and left alone as my counselor walks back to eat lunch. After about 15 minutes of waiting, a doctor pokes her head out of her office and asks me what's wrong. I tell her, I've felt sick since I woke up. My throat hurts. She feels my forehead and says you don't feel warm, but I'll get a thermometer. She comes back with a thermometer and puts it under my tongue. I had a fever of 102 and strep throat. At a tightly packed dining hall surrounded by kids with compromised immune systems. I'm surprised I didn't get anyone sick, but the fact that it took 5 hours to get a chronically sick kid some freaking medical attention still makes my blood boil. I was bedridden for 3 days and missed literally everything I wanted to do while there. The worst part was this was my last year before I got too old. I was losing my hair, my gums bled randomly, my skin looked like butt, my muscles cramped up randomly. I literally fell over once while standing on both my feet. I got horribly depressed. World felt like cardboard is the only way I can think to describe it, and all I wanted to do was eat and sleep. Sometimes I would start talking in conversation and get a word jumble midway through where words didn't come out right, which was the beginning of some social anxiety for me. I went to several doctors who plainly thought I was full of crap. Several of them asked me how much I drank, and one of them asked me over and over again as if he didn't believe me when I said I didn't. I was tested for low thyroid, cancer, rheumatoid arthritis and some other scary things, but nothing came up. This was over a 6-month period. I finally figured it out by googling my symptoms, which led me to a message board that suggested I find a doctor who would give me a blood test for it so I would know for sure. Turns out I was really low on B12. Somewhere in the low 300s I think. They went from nearly IRLing me to my face to giving me a B12 shot in the office before I left on my second visit and prescribing sublingual B12 to me. I actually found out a few years later that I have a gene mutation that keeps me from methylating B vitamins. I mention it to every new doctor I see now and they always look at me like I'm a hypochondriac. Then look it up on their laptop and kind of go okay like they're relieved I'm not full of crap. It took me a year and a half to find a doctor who tested me for B12 and gave me shots. Mentally it was really difficult to describe my state. I am so happy I never have to relive that again. Not exactly accused of faking it, more so just disbelieved or taken lightly. I went into emergency at the hospital, because it was Saturday, for a medium level abdominal pain that had been ongoing since the previous weekend. I'd been to the GP on Wednesday or Thursday and had a blood test booked for the coming Tuesday, earliest possible. However, my mum decided to take me in because of how long it had lasted without change. At the hospital I had a blood test taken and the doctor thought 50 milligrams of codeine would take care of my non-problem. It did nothing, so he gave another one and Panadol. He ended up believing and sending everyone frantic when I ended up bent over, frothing at the mouth and coughing up blood, and the blood test said pancreatitis. Several years ago I walked into traffic in a sort of vague dying would be nice kind of way. When I told my psychologist about this, he rightly had me carted off to the ER to be admitted into inpatient care. They shuffled me from room to room, and eventually stuck me with this teenage girl who appeared to be having severe pregnancy complications. In the hall I could hear a woman screaming and vomiting violently. We sat there for hours. Finally the doctor came. By this point I was completely numb. She asked me questions. I answered. Do you have any plans for suicide? I'm not really the planning type. She finally said, well, you look fine to me, and sent me home. I bussed to my apartment and lay face down on my couch for several hours. I passed out walking to school, so my brother called an ambulance. Paramedics were hesitant the second time it happened and began asking if I was trying to get out of a test or if someone was messing with me at school. Turned out I had stage 3 colon cancer at 17. Glad you're okay now. Had an asthma attack once and a middle school nurse didn't believe me. Told me to get up and go back to class. Took 5 steps out the door and passed out. Woke up in a hospital with tubes being jammed in my nose and a mask over my face, oxygen and albuterol. And never was a claim about asthma ever not taken seriously ever again in that school district. Not really accused me of faking but misdiagnosed me. Had horrible loss of motivation and was so up and down with my emotions. I constantly slept and never felt rested even after sleeping for 10 hours. Doctor told me I was just depressed and put me on meds. They made me feel like a zombie and I couldn't concentrate, so I stopped taking them. A year later I went in for checkup with a different doctor and he found a lump on my thyroid. Turns out I have Hashimoto's causing my hormones to go up and down constantly. Basically the other doctor was just putting a band-aid on symptoms and never bothered to find the underlying cause. Not exactly accused of faking it, but here's my story. One night I was working at this bar, and suddenly I'm overcome with an excruciating pain in my abdomen. Low left quadrant, just below my rib cage. I would rate the pain a solid 9. And the only reason I don't say 10 is because I've never been shot, stabbed, or anything like that. So I reserve my 10s for the really extreme stuff. But it was serious pain. The kind where I couldn't even carry a conversation. The pain backs off to about a 5, so I duck out of work, thinking I'll go home and see if it happens again. But on the way, it jumps back up to a 9 again, maybe a 9.5. I pull over at a gas station and call 911 because I can't drive and I don't know if I'm dying or what. I writhe in agony for 10-15 minutes while I wait for an ambulance, and wouldn't you freaking know it, the pain drops to a 0 the second they get there. The paramedics check me out, do an EKG, what have you. I'm fine. They take me to the triage nurse decides I'm fine, and I have to wait. When I finally see a doctor, it's this P-off resident who's probably on hour 61 of her shift. By this time my mom and stepdad have arrived. The doctor has a thick accent, and my stepdad very casually asks her where the accent hails from, purely making small talk, no malice whatsoever. The lady gets all bent out of shape about it, like does it matter where I'm from? Anyway, from that point on, she's not listening to anything I'm saying. She asks me if I've had alcohol in the last 24 hours, and I say yes. I had a nightcap last night. She asks what's a nightcap. I told her it's a drink right before bed to help you sleep. I tell her I had a one whiskey, and it's truly all I've had in the previous 24 hours. She finds the concept of a whiskey before bed baffling. She says she doesn't believe that's all I had to drink. She basically tells me I'm an alcoholic. I'm not, and that the pain was from drinking too much. And then she discharges me. I've never felt that pain before or since, and I have no clue what it was. But a crappy doctor chalked it up to a BS diagnosis, and that was that. Doctors overdid it. Even after learning and seeing the gross and gory aspects of medicine, what still makes your skin crawl? I can handle skin sloughing diseases, gore, and head tweakers just fine. But dang, I hate parasites, bedbugs, scabies, tapeworms. Fun fact: you can end up with tapeworm eggs in your brain if you have tapeworms and your hygiene is rank enough. How rank is rank enough? Large parasites that live in the skin. I can deal with worms in the organs, or microscopic spiders living in my face pores, but when it comes to scabies or botflies I want to claw my own skin off. All the creepy crawlies living where they shouldn't be. The more slithery the worse it is. A kid is awoken by intense pain and a scratching sound in the ear, usually a cockroach. Not so bad, but a hassle to remove piecemeal leg by leg if it comes to that. Some guy is complaining of nasal congestion and some bleeding months after a vacation. Yup, leeches in the nasal cavity. I'm never going swimming in any rivers ever. Diabetic patient complaining of a non-healing wound behind his ear. I scoop out dozens of maggots from underneath the skin flaps and they're falling on the patient's stretcher. A pregnant patient admitted for delivery is complaining of itching down there after maybe straining a bit too much. An Ascaris roundworm is poking its head out the butt and saying hello. Always makes me gag when I have to be the one to remove them. I'm a trauma surgeon, so blood and mangled bodies doesn't really faze me, but full body skin conditions do. Things like eczema herpeticum and Norwegian scabies make me itch all over and really uncomfortable. Eczema herpeticum. I can tell just from the amount of time it took me to pronounce that it isn't pleasant. Very little does. I can see blood, guts, death, and very little phases me. But watching any video of somebody breaking a bone gets a big nope out of me. The fricking Louisville basketball player who had his tibia break through his skin during the game is the worst thing I've ever watched on live TV. How cruel people can be. Dealing with disease is one thing, but dealing with victims of any kind of assault, domestic violence or mass tragedy is chilling to the bone. Yet, I can only imagine how hard that must be. I've seen all sorts of disgusting and gory things which uniface me, but for some reason chopped or dismembered fingers still get me. Kinda the same here. Crazy injuries, gore, infections etc. fascinate me, but anything to do with clean, deep cuts I can't handle. Scabies. Definitely scabies. Don't want it. Don't want to be near it. Try not to touch people I'm diagnosing with it. Makes my skin itch just thinking about it. Patient as mrsa. Skip the gown because we all have it. It's fine whatevs. Patient has scabies bedbugs. Jesus freaking Christ, where the frick is my third PPE gunter? I need 6 gloves and 4 shoe covers, and if they even so much as touch me I'm taking a bath in bleach. I left my phone in the break room because if it fell out of my pocket it will stay there till the end of time. Obligatory, not a doctor but work at a vet. Abscesses. Degloving. Hit by car. Fine with all that. And a little fascinated. Maggot cats though. Shudder. For me it's nasty teeth. There are very few things that move me in any way, medicine or otherwise. But damn nasty teeth. I could never ever be a dentist. My friend works in emergency medicine and can't stand hand wounds. She's the toughest, most bad butt lady I know, but hand wounds make her swoon like a medieval maiden. Among other doctors I know it's usually skin conditions and burns. The common thing we all hate is abuse. For me it's nasty teeth. Do not try to Google images of rotten gums. They are nasty and maggot filled and just sad, and I'm going to brush like 10x more than normal when I get home now. I don't mind pus, blood, poop, urine, but for the love of God, I can't stand saliva. It grosses me out when anesthesia suctions out saliva. Arty here, love me some sputum all day long. Night shift actually. There's nothing quite as satisfying as sucking a huge goober out of the back of someone's throat or a trach. When you really clear them for the first time since they arrived and it's so thick it won't even get down the catheter. For me, vomit is the line. If I smell vomit it makes me vomit. Not a doctor, but a former funeral professional. I've seen and smelled and handled the goriest of gore in my day, but I still can't stand cleaning out someone's nostrils and getting crusty boogers out. Hawk. You should just hold a tissue up to their nose and say blow. Not a doctor, but I was a combat medic in the army infantry with several deployments to Iraq during the war. Interestingly enough, I dealt with a lot less gunshot wounds than I thought I would, all things considered. I guess the body armor they issue really works. There was a lot of trauma from explosives though. Anyway, I was fairly immune to most injuries I encountered, including a pretty bad head injury with exposed brain matter. He lived, by the way, but one thing that will always make my skin crawl just to think about it is burns, especially full body burns. I'm always grateful that I never had to be on scene when treating severe burns, but I did work in several aid stations and a hospital stateside that received and treated people with 3rd degree burns covering most of their bodies. Thank God or whatever whoever that these injuries were far less common than others, but if you ever meet someone who said they were a fueler in Iraq or Afghanistan, they had what was potentially one of the most dangerous jobs in the war. Fuel trucks don't mount armor. I probably shouldn't tell you this, but, well, I feel like you should know. You have eyeballs. I'm so sorry. My wife dislocated her kneecap several years ago. The nurse told us that she can handle cuts, blood, all manner of bodily fluids, but things out of place still make her queasy. Oh geez, I did that at work a few years ago. The sight of that made my stomach drop. I still cringe thinking about it. I can't even see or hear the phrase Fernie's gangrene without cringing. Don't Google image search that at work unless you also work at a hospital. Also, I really don't like going into patients' rooms when they have bedbugs. Even if I gown and glove before heading in and only touch them to do an exam, I will have phantom itching for hours and then change clothes in my garage when I get home because nope. Made a mistake. Googled it. Nearly vomited. I work at a maxillofacial surgeon's department and I've seen a lot of procedures which don't faze me. Teeth extractions, upper and lower jaw realignment, traumas of all types, broken jaws, broken orbital sockets, oncological procedures, explorations, the lot. But there's one procedure that makes my gut wrench, rhinoplasties. There's something about that open nose and people cutting and prodding around that makes me so uncomfortable. I don't know why. The knowledge of how often filing is used in plastic surgery is what does it for me. Jaw filing, etc. Doctorb. Nothing visual physical really gets to me these days. Smells can be absolutely ghastly, but people's suffering can be profoundly affecting, both patients and families. Upvote for Doctorb. Any injuries to nails just make me go weak. Fine with eyes and all the other crap that usually fricks people up, but nails. Work. When I was a student I was watching something have finger surgery under local anesthetic. Finger was numb. Surgeon was prepping it to cut and had this little tool in his hand. Suddenly rams it under the fingernail and hoiks it off. Wretch. Anesthesiologist here. Blood, gore, and people trying to die on me don't really faze me much. But when I'm in the eye room and the surgeon sticks a needle into someone's eyeball I have to suppress a shudder. I work with vulnerable adults and people with dementia in old age psychiatry. The number of people financially exploited by their family is very disheartening. People need to learn some humanity. My wife has been a family practitioner for 10 years. She says the only thing that really still grosses her out is nasty, unclean nose issues. I'm nurse. I can handle pretty much anything. Leg mangled, arm in half, head blown off by a shotgun, you name it, but if someone has a runny nose, green boogers hanging out of their nose, it takes an act of God for me not to gag vomit. Answering for my wife since she's an doc. She's been studying medicine since her teens. Both her parents were doctors, but she still can't bring herself to go into the morgue if there's a child there. Dead children are very, very difficult for her to deal with. Prediction. Not a doctor, but also not a doctor, but my brother is, and he always says the way a lot of elderly people are treated really gets to him. Sometimes by their carers, sometimes by children and other relatives. Often he talks about people hanging around like vultures, waiting for them to die so they can get their inheritance. Obviously this isn't the case with all elderly people, but it's common enough. My mum is a nurse that specializes in palliative care, and has often told me the same things. Fecal vomiting. Basically vomiting diarrhea from the mouth. I guess constipation has to be resolved somehow, sometimes just not from where you think. I've done that. Christmas night 2006. I was in surgery a few hours later. God bless the NHS. It didn't taste very nice, but, to be honest, you're so chucking ill you don't care. My buddy who isn't a doctor really hates volunteers who come to the hospital to play music, like loses his crap insane. He moved to a local hospital because it only allowed one instrument to be played by volunteers, and he thought he would really never hear it again. They had a harp only policy, and now, once a week, a woman plays the harp, and I freaking love it. Nails. When someone's been in some form of minor trauma and their nail has been peeled off, worse than any vomit, feces or sputum. My daughter is a physician assistant. She said the morbidly obese patients who come in with maggots crawling out of their vagina or from between the folds of their flesh does it for her. Nope. Nope and a double nope. Student nursino plus E. I've seen some crap, but generally anything to do with hurt kids, I'm far too soft for their tears. Usually you have to go through your gastro rotation before you've seen some crap. Not a doctor but a wound-ostomy nurse. I see all the gnarly diabetic feet, mummified limbs, trauma wounds, failed surgery incisions, colostomies, fistulas, pressure injuries etc, but the idea of starting an IV makes me want to cry. I've only ever started one and was lucky to find a passion in nursing that has nothing to do with pokes. OMG, I absolutely cannot do IVs or blood draws. Somehow I made it through school and through various clinic and research jobs without having to do it. I eventually became a psych NP, so there was absolutely no chance that I'd ever have to do anything with veins. And I bow down to you, wound-ostomy nurse. You truly are an angel that walks among us. Prion diseases. I don't love blood veins, arteries, but I can deal with them. Poop, pus, gore. I can handle it all for the most part, but I thought about prion diseases and what they do to you too much the other day and almost passed out at my desk. I don't know why, but the thought of them just makes me queasy and lightheaded. Just typing this is starting to have that effect. I'm not a doctor, but seeing those videos of a knee replacement where they are removing the anchor from the tibia and they have to literally whack it out with a hammer. I work at a children's hospital and SNAT or suspected non-accidental trauma aka child abuse still really gets to me, especially when the suspected abuser is the one bringing the child in. Also scabies, bedbugs, lice, and neonatal, newborn, herpes. Not a doctor, but I've worked in medical education and policy for 12 years, so there's very little that grosses me out anymore. But a while back I sat in on a wound care educational activity that was case study based. The second case study was a post-surgical patient where a combination of refusing follow-up care and super morbid obesity had caused wound separation underneath a fold of fat on the abdomen. This person was like 2 years post-surgery and had an open wound festering in a massive, wet, bacteria-ridden crevice of their body. Just typing that out almost has me dry heaving. It was the most disgusting thing I have ever seen. The doctor teaching the course waited until everyone had made uncomfortable noises and then said, "Now imagine the smell." No, thank you. The photos are enough to haunt my nightmares until the day I die. Hopefully not from a festering wound. Not a doctor, but I had an emergency room doctor look in my throat after an allergic reaction and say, "Oh my god," needless to say it didn't help me calm down at all. I'm there thinking, this is an emergency room. These people see some crazy crap. This is probably kinda bad. EMT. I can handle blood, gore, vomit, feces, urine, and all the emotions that come with it, but for some reason I can't do boogers or mucus. It makes me gag to no end. Facial fractures that involve teeth. I can clean up open fractures, close up gashes and lacerations, assist during amputations, or even examine festering sores without batting an eyelash. But there's something about traumatic loss of teeth that really unnerves me. Loose teeth, broken teeth, open jaw fractures. Basically anything that might need a maxillofacial surgeon makes me gag a little bit. Med school teaches you one heck of a poker face though. I'd like to be a doctor and this thread is making me reconsider. Maybe I'll just be a vet instead. Oh, maggot kittens. My weakness isn't one specific injury but the kind of panic that comes with an obviously deadly injury. Like someone that has their throat cut and the look in their eyes that says, "I know I'm going to die. Please help me." That crap makes me freak out. I have pretty dang good crisis handling skills and I can do CPR like a champ, but if the person that was injured starts begging to save them or something, I will panic like a frightened child. Not a doctor, but I work in pharmacy. We won't judge you on nearly anything, but I admit I get the heebie-jeebies when people have RXS for scabies. Something about whole body parasites is just so unsettling. Dentures, especially gunked up dentures that aren't in the mouth. The other day, I was talking to an elderly lady on ward round. I was holding her hand as I am wont to do with my frail elderly patients, especially those with dementia or delirium. For some reason, she suddenly decided to remove her top dentures with her other hand and plonked them on the table in front of her. I spent the rest of that discussion with my hand in some kind of vice-like grip, being slowly but surely inched towards the dentures while I tried desperately to resist. Every now and then, she would stroke my arm with her still damp right hand. Anyone working in geriatrics knows the horror of the unexpectedly moist examination. But urine, feces, vomit, blood, snot, sputum, saliva, etc. I can easily take in my stride. However, dentures definitely turn my stomach. I think we all want to run away screaming when someone is infested with lice or bedbugs. You just feel like things are crawling on you for days. I worked in the ED for a bit and one time we had an entire family come in with scabies. Going into their exam room was unnerving. Patients with serious infections. I've dealt with only a few in my practice, but god dang. During medical school I saw some of the grossest infections ever. Also diseases of the skin. I would have went into dermatology if I could handle them. Not a human doctor, but a vet tech. I can't take anything but parasites and eye injuries. My surgeon wound care friend claims phlegm. She says you have no idea how crazy it can get. I counter that with bloody pus-filled swollen body parts that you need to take a huge needle to suck out. One of the worst smells ever. But the prize goes to cancer. Tears in my eyes, the worst part of someone you love dying. The saddest and worst was a 10-hour Greyhound ride with a woman on board I'm sure was dying of cancer. Skin fetty. Esp the kind off of old people's feet. You just peel off a sock and that crap gets airborne. Makes me wanna exhale till I pass out. Doctors of Reddit. What are some moments that made you wish you had never became a doctor? We had a new student come and do rotations at our hospital, and being new I had the honor of supervising her first digital rectal exam. As soon as she inserted her finger, the patient proceeded to evacuate his bowels all over her hand lab coat and she began vomiting all over the patient. It was hilarious and disgusting all at the same time. Watching children die. Torturing the 90+ end-of-life patients because their children are unreasonable and don't want to let go. Teaching new interns the same bulls every year. Watching all the malpractice that goes on around the country. Torturing the 90+ end-of-life patients. I work as an EMT. Last week we picked up a 97-YO who was altered. She had a DNR and DNI on file. The son was there and he was the proxy. He wanted us to ignore the DNR/DNI if she coded during transport. I tried explaining what we would do and how that would not help her go against her wishes. He ignored me. I cannot imagine the stuff you have to deal with. I had a 9-year-old girl brought in one night with her parents complaining of fever and respiratory distress, presenting with coughing and wheezing. The kid was really out of it and the parents were very upset. I thought it was bronchitis, but I admitted her and ordered treatment for her fever and cough as well as throat cultures. I was with another patient when the kid started hallucinating, sobbing and spewing everywhere. I figured it had to do with the fever, so I packed her with ice, but she died maybe a half hour after that. This wasn't my first death, but it was one of the worst. I couldn't tell the stiff neck since the kid was out of it. She also couldn't tell me anything else that would point to simple or complex seizures. She died of Neisseria meningitis. Completely wrong diagnosis. To make matters worse, we called in all her schoolmates and anyone else we could wake up just in time to see 3 other kids go. The rest got antibiotics quickly enough. Probably my worst day in medicine. This is one of my favorite stories from my mother. She has been a doctor for probably around 30 years now. When things go wrong with patients, she takes it hard. The experience that sticks out to her happened when she was in Russia. She is an American, but went abroad to do some volunteering. She met a young girl living on the street who was very ill and, at the time, around the same age as me, her daughter. She had no family, no money, no food, nothing. My mother treated her as best as she could and spent several days playing with the girl and keeping her company. This girl was so grateful she insisted my mother take her only possession as payment, a ripped plastic shopping bag. My mother initially refused, but eventually they agreed to tear the bag in 2 and each keep half. My mom never really wants to talk about what happened next, but I do know when she went to find the girl again a few weeks later, she had passed away. My mother was devastated. She keeps that ripped plastic bag tied onto her stethoscope and about to this day. Makes me sad when I see it. My mom says she learned to not take her ghosts with her, but that one will always stick. By far the saddest story I've ever seen on Reddit. Not my experience, but my mom's boss. He became a doctor and was getting overall fed up with it. One night a homeless person came in that was covered head to toe with lice. They put him in some kind of dunk tank, but the nurses were running around dealing with other things and the guy drowned in it. He left the profession and went back to school to become a lawyer. He got fed up with everything involved with that and went to work for OSHA. My mom said he was the most caring boss she had there in over 30 years. What a horrible way to die. 1. Starting residency and realizing your work schedule is pretty much set in stone for at least the next 3 years, and you only get 4 days off per month. 2. Feeling the stress of loan repayment, watching as about $10,000 of interest is capitalized each year of residency on your loans. 3. Chronic stress from knowing that your actions and decisions that you make affect whether or not people live or die, even at the earliest part of your career. Looking back at decisions that you made and wondering if you had done something different, would that patient have lived? 4. Having to tell strangers on a regular basis that they are going to die, or their parent's spouse is going to die, or worse that their child is going to die. One of my quasi-elderly patients had terrible bladder control issues. Pills didn't work, and surgery was not an option, so I refer her for a pessary, which is a rubber donut-shaped device placed in the vagina to lift the bladder. She came back in a few months later with pelvic pain, and it became obvious the referring doc wasn't clear about her need to remove it monthly to wash it off. We get her in the stirrups, covered with a sheet. I sit down, not realizing how much wafting that maneuver would create, until the smell hit. My eyes began to water as I held professional composure, and it looked up at my nurse who was clearly also dying just a bit inside. Time for the speculum exam. Words cannot describe how bad the yeast and or pus was. White goo covered everything, and was oozing out like molasses. Just get in and get out, I thought, but no, the pessary would not come out. I had to stand up, stabilize my footing like I was in a tug of war, and reached in with just a couple of fingers. I got around the edge and pulled, and that sucker was stuck. Finally, as the seal started to separate, we heard a grand sucking sound that even the semi-deaf patient heard. There was a bit of blood, and the mixing with pus yeast reminded me of strawberry quick, but we got it done. She chose not to have it replaced, ever. TL. Dr. Nope, you gotta read it to believe it. Well, med school final year here. It's just the misery you see every day. Small children dying. Old people they're in the hospital beds where no one is by their sides. And since I am from India, we see this gloominess on the family's face when we break out the news that they just had a baby girl. They are so excited about the delivery otherwise, but as soon as you tell them it's a girl, they make such a horrid face and tell you to get out of their face. This when you face almost every second day gets you so mad that you wanna break their heads but can't do anything. That is the time I regret being in training for being a doctor. Nothing has ever grossed me out enough to make me wish I had never become a doctor. Pee, crap, vomit, tissue necrosis, pus, whatever. I knew what I was getting into. Nevertheless, about 9 months ago when I reconsolidated my loans and saw how much I owed total and what my monthly payments would be, I banged my head against the desk and thought to myself that I should have been a plumber. As a GP I have it pretty good, and I can honestly say that I am satisfied with my line of work. I'm glad I wound up in medicine. I love talking to patients and don't have any regrets. Having said that, I trained in NYC, and it was very hard to be working on weekends and evenings when everyone else was out partying. You could see Greenwich Village from our hospital, which didn't help during those stressful night calls in the ICU. Once, as a med student, I got up at 4 AM on a Saturday to take the subway to the Bronx for a surgery rotation. Walking to the train, I passed a diner that was packed with people. I wondered why it was so full at 4 AM. Then I realized, it was still Friday night for those people. My father responded with, when I realized someone had to take care of problem hemorrhoids on Christmas. Edit. Liberal arts student here. Can't spell anything medical worth crap. Well, my brother, a 4th year med school student, recently told me an experience he had to deal with that made me question whether I could handle being a doctor. 4 19-year-olds came in after a horrific car accident. They were all drunk, including the driver. The first guy was pronounced dead on arrival. His chest was completely caved in. The second guy's head was just a pulpy mess and they had to sedate paralyze him so he wouldn't flail and further screw up his skull. The third guy had to have his chest drained after massive internal bleeding. And the fourth, a girl, somehow got caught under the car apparently and her pelvis and femur were completely shattered. Granted he wants to be an ED doc, but man, I've always wanted to do pediatrics. And while I may never have cases as gruesome as this in pediatrics, I might have a patient die, a child that you witness grow over the years. I have been rostered to the bone marrow transplant unit for the last 10 weeks and it has been the most miserable weeks of my life. Our patients die often and are usually reasonably young, aged 16-60. They have terminal hematological cancers and usually the transplant is their last hope of survival. 1/3 die in the first few weeks, 1/3 do well and 1/3 have horrible chronic complications. The thing that gets me the most is that they fight the bravest. most courageous, excruciatingly painful battle of their lives and frequently lose. To see a patient with multiple infections, destroyed joints from septic arthritis and bloated and distorted from 10 kilograms of extra fluid on board endure excruciating pain for 2 weeks only to die in the end. It's heartbreaking. Often I go home and cry. 4th year medical student here. Last week, I had to do a pelvic exam on a gross 20-year-old with a horrific gonorrhea chlamydia infection. FML. Doctor here. My list. 1. Listening to patients addicted to pain meds beg for more. 2. Ordering labs that are not medically necessary but my family member read on the internet. 3. Listening to colleagues complain about Obamacare. 4. Patients who won't take their medications but will take every supplement known to man at GNC. 5. Hospitals that transfer patients to us that could easily have been cared for at the smaller facility. 6. Family members who think Aunt Sally, who had a stroke, has heart failure, is 90 years old and is intubated, should still be full code, i.e. that a good outcome is still possible if CPR is needed in this case. 7. Letting insurance companies dictate care, which I don't allow. The list goes on, but I still wouldn't trade it for another gig. Helping patients truly in need is very rewarding. Cheers. But this St. John's wort isn't a chemical man, it's all natural, and that has to be better than this highly researched other medication. When I was a junior surgical trainee, called to emergency to see a homeless guy complaining of foot pain, likely ischemic limb. He was wearing boots. In order to examine the foot I had to take the boots off. Pulled really hard. Boots wouldn't come. Kept pulling. Heard a crunch. Boot comes off. Maggots and liquefied flesh pour out. Leg stump with protruding bone. Waft of pure necrosis fills my nose. Ran out of cubicle. Vomited. Became a radiologist. Ington here. I work in the ER of a government hospital. I get a lot of ungrateful patients wanting special treatment. I have to explain calmly that I attend to those with life-threatening conditions first. My hospital is a trauma center encircled by depressed areas, so we get a lot of patients. Should put up a sign that says, those with life-threatening conditions will be treated first. If you don't have a life-threatening condition and insist on being treated first, we will provide you with one. My brother is a doctor. One day they brought in a dead body for an autopsy. He recognized the girl as an old friend of his. Also, he delivered both of his children. I don't know why would anyone want to see his wife's vagina get destroyed. When my wife has babies, I will be noping nearby. Side note, my parents are also doctors. Everyone was in the room. Sometimes, even I don't understand my own family. When it is your kid being born, your wife's vagina means diddly jack crap. I was surprised to see this thread filled with gross out stories. I've seen my fair share of funky and smelly things, and been sprayed with fluids I didn't know existed before medical school, but I expected that going in. That may have directed me away from certain fields but not from medicine. The moments that make me wish I never became a doctor are the flashes where I see the true job landscape out there. I will not have the option of getting the job I want, won't be able to work where I want, and won't even be able to start working as a staff doctor until I pull off a couple of additional years of fellowship to be competitive. After chugging through medical school and putting in 80 hours weeks in residency, there's no pot of gold at the end. I'll be graduating soon from one of the most world-renowned radiation oncology departments in the world, and it's no help. In Canada, the unemployment rate for recently graduated specialist physicians is higher than the national unemployment average. In my discipline, it's about 50%. The issue isn't that I'm picky, it's that there aren't jobs. People are doing huge amounts of extra training to get competitive for when that one spot opens up, and all we want to do is treat patients. Try explaining it to others too. That makes me wish I'd never became a doctor. Every conversation someone says, frick it, you're a doctor, you'll be fine. But I can't easily find a job in the same city as my parents like you can. My girlfriend will have to give up her job to come with me, and I'll be stuck in my 30s looking across North America for my first position. My friends working the oil rigs, if they haven't wasted it on H and blow, should be $1 million ahead of me by then. Those are the moments. I love what I do. I truly love it, and it's an honor to do it. But if I had any idea what the job situation was really like, I would have done something else. Many people say if they won the lottery they'd take care of their friends with new cars and junk. I tell myself that if I ever win the lotto I'll try to get a few more doctors and specialists to move to my town. From numerous comments in this thread it seems that paying off student loans would be a major enticement. I'm very new, but I think missing something is the worst. I had a terribly sick guy develop severe edema. I shut off fluids and gave him Lasix. He was having a severe heart attack. No complaints and no chest pain. He died overnight and I felt terrible. My attending reminded me he had a brain bleed anyway and we wouldn't treat the heart attack anyway, but I still missed it and it still got to me. He was old and had terminal cancer, but I'll never make that mistake again. He was doomed, but you helped and you tried. Ultimately that's all that matters. This is a story my father told me about his residency. One night, while he was in the air, the paramedics brought in a girl who had been assaulted and had her eyes gouged out. He said they brought her in, handed him her eyeballs, even though it is impossible to reattach eyeballs with severed optic nerves, and left. Later that night members of a rival gang of which the aforementioned girl was affiliated with, returned to try and finish the job. I trained and work in Australia, but I have worked a stretch in a tertiary referral hospital in Southern Africa in a resource-limited setting. One afternoon I admitted a 20-year-old man in severe respiratory distress, likely PCP pneumonia. He presented way too late and the policy in that hospital was that patients with HIV did not go to the ICU. There was nothing we could do, and all I could think about was what I would be doing if this poor guy was in Australia. Universal healthcare is fantastic. As it was I admitted him to the ward and watched him die over the next few hours. I am a final year medical student, so not yet a doctor, but my first urinary catheterization is a story that usually gets a lot of laughs. There was an elderly gentleman who presented with severe urinary retention. He had not urinated in several days and his bladder was so full of urine you could feel it, about the consistency and size of a softball. When palpating his lower abdomen, the nurses asked me if I wanted to catheterize him, and as a typical eager and overconfident third-year student I gladly accepted the challenge. After inserting the catheter and draining some of the urine into a small collecting dish, I went to connect the catheter to the catheter bag. Stupidly, I pointed the catheter upwards, staring at the opening as if I was staring down the barrel of a gun. The patient then proceeded to cough, resulting in a torrent of urine shooting out the end of the catheter and all over my face. In the moment, I was pretty disgusted, though I won't say it made me wish I wasn't pursuing the career I wanted. It did, however, influence me to pursue pediatrics rather than working with adults. For the rest of my time working on that ward, I received quite a lot of laughs from residents, nurses and attendings. The silver lining is that it provided me with a great story to tell people when they ask me what it's like to work in the medical field. Watching helpless how the spawns of some of my patients absolutely destroy my office while I'm trying to do my work and their parents don't even bat an eye. Sometimes I go postal in my mind just to vent a little while reviewing their medical history and finally calm down when I realize that I only have to tolerate them for as long as they're there, not my whole life. One of my colleagues, who was a fantastic physician and good friend, committed suicide last year after being struck off the register after he was found to have been injecting ketamine on a regular basis. This made me think about how stressful the job is and how someone who I respected so much and someone who was really progressing the field could find themselves in a horrible situation. I'm not a doctor, but I can tell the story that made my mom go into medical billing rather than becoming a nurse or doctor. She was working as a medical assistant when she was in her late teens and early 20s and planning to go into medicine. Her employer was this elderly Italian doctor, really old school in terms of technique and attitude and kind of a badass guy despite his age. One day, she checked in a woman who had recently had a mastectomy performed. When the patient came in, the smell emanating off of her was palpable and she was visibly dirty. My mom put her in an examination room and brought the doctor. The doctor started unwrapping the bandages around this woman's chest. With every layer, the smell grew stronger and more nausea-inducing. It was clear the patient hadn't followed the directions about changing her bandages at home. The doctor finally reached the last of the bandages and yanked them off. The source of the smell became instantly obvious as maggots started pouring out of the patient's chest. The doctor started shrieking and slapping the maggots off of her. screaming at my mom to help him, though neither of them really knew what the best course of action was right at that point. My mom tells the story with fondness, but it was that incident that made her go into the bureaucratic side of medicine rather than staying in the trenches. If they were fly maggots, they only eat the dead tissue. They were helping. I'm a PA in ENT and I'm pretty happy with how things turned out. I assist in surgery and get to do some relatively simple office procedures. I work 40 hours a week, 1/2 day, Friday, which is awesome. No weekends, no call, major holidays off. Get to help lots of folks out. Buzz weird things by my attending docs, who are alright. Student loan sucks still. Like said earlier, older practitioners seem to have skated through the inflated tuition and bank more money, a golden age, as said by some of my peers. I have roughly $100K in student loans. Kind of wonder what the difference would have been money-wise if I would have stayed as a medical technologist, CLS, making $60K. All said and done, I'm happy where I'm at and would recommend it still. Here's to hoping the student loan bubble collapses. Cheers. I'm a pet groomer. Groomed my very first cat not too long ago. She died in the cage while drying after her bath. According to the vet, she had a panic attack. I will never groom another cat again. Not a doctor, but did a stint as a cornea recovery tech for a few months. Basically the job is to harvest corneas for transplants or medical research. This happened to my boss. The first night he went out by himself. After training, he had to go to a morgue to operate on a young woman who had gotten a bad car wreck. College town. Heavy drinking. Ran car into tree. Ejected through windshield. The young woman's face had been partially slewed off, along with the skull being split in half. He had to hold tape the skull back together so he could remove the corneas aseptically and properly. The worst part? The young girl's phone was ringing in her pocket the entire time. This was from her friends, calling her to see where she had gone. Only my boss, the girl's parents, and the doctors knew she was dead at the time. Gladly didn't experience any of that myself. Not quite sure how I would have handled it if I was in his place. I've been a doctor for 3 years now, so I'm relatively new to it. For me it's when you're 71 hours into a shift, have had about an hour of sleep and are called to review someone that's acutely unwell. You'll find yourself not caring, purely from fatigue, and at that point you'll hate yourself and the job that's making you become what you've always hated. I'm happy with my current career as a radiologist. There are some very sad stories though. It helps that most of my friends and my partner are all doctors, so we all thrash out the difficult stuff together. Radiologists are awesome. As you get older and more distinguished, you can make the connections to start working from home still as a radiologist if you wish. My father has been a radiologist for 40 years and currently he works from home in a system where he is sent a set of x-rays, writes a report on those x-rays, and sends them back. I am not a doctor. I know it, but I work on medical malpractice suits from the legal side. I have always thought it must be very difficult to do everything in your power and still have things go wrong, and then get sued for it. I work on damage quantification, so I don't usually read the medical report details because it isn't relevant to my report. But since I'm a parent who suffers from morbid curiosity, I sometimes look through when I see the date of birth is the same as the date of injury. I am amazed how often I read through a statement of claim where the doctor's actions follow all the standard procedures for a complicated birth. Emergency C-section, use of forceps, all of them have risks. Sometimes bad things happen. I think it would be difficult to have a close call, save the patient, save the baby, but then be sued because either mother or child or both were injured in the process of saving their lives. Not me, but my dad has been a paramedic for over 30 years now. He's said there's things that you'll never shake from your memory. Things like being called on a beautiful Saturday morning for someone who killed his wife and kids with a hammer. Hospital work is tough, emotional work, but sometimes I believe first response is harder. Being at the scene must have a whole other sense of horror than seeing the patients come in and imagining the scene. M's medical people at music festivals. What are your most crazy stories? Some people next to us are Fisher's Labor Day weekend shows, not a fest, but a bunch of people camp outside the venue, have this bike pump. They fitted the end with a little cup and were blasting coke up their noses with it. We heard M jokingly say, you know those people that party too hard and get taken away by medics? That's totally gonna be us. Well, it was them at like 4 AM Sunday morning. IDK. I think that's freaking hilarious. Freaking works. A guy jumped from the nosebleed section and then yelled, what's my favorite type of fruit pie, and then we took him away because of being so high on drugs and having a concussion. Bazlides 2015 in Hampton, Virginia. This girl was running around the venue topless, mercilessly crushing a water bottle, which was empty, in her first, running up to people and shoving it in the faces screaming, does anybody need any water? Her pupils were black as night, and she was grinding her teeth to a pulp. It was terrifying. I worked campus M's in college and got paid to watch T-Pain perform. He had them turn the bass up so much ceiling tiles fell onto the basketball court where the concert was being held. Later in the show, when girls started throwing their bras on stage, he grabbed a handful and started humping them. Also was on duty for 303, and before the show 2 guys walked by. I legitimately thought from the look and smell that they were homeless, but apparently it was the band. Later on they threw a box of pasta and some chicken wings into the crowd. LOL, T-Pain is a cool dude. I work at Bonnaroo and got to talk to him for a little bit. I always thought you EMT guys had it rough, much harder work than what I have to do. Got called to an unresponsive person in a stream a few years back. He was almost K-hold and high on GHB with his head dangling off the end of an inflatable couch just touching the top of the water. Seriously, if he fell off he would have been a goner. As a harm reduction based first aid team, we brought him to a semi-coherent level of consciousness and explained why it was a bad idea to pass out in the water, and he got quite upset, which led to one of my favorite quotes from a festival ever. Bro, it's a rave, and this is how I party, man. A few inched away from drowning apparently. Since he was awake, we brought him and the Zouch to shore and bid him good day, then got called to the girl who had OD'd on GHB in the middle of the stream and was barely breathing and totally hypothermic. We worked on her for hours and she made it. Point is, don't do dissociatives around water, kids. Unless it's a rave and that's just how you party. Ketamine and water definitely do not mix. So easy to drown. I'm an EMTB. I worked an anime convention nearby, and let me preface this by saying that every neckbud weirdo on the face of the earth showed up to this thing along with a slew of every other weird drug using person you could imagine. They had an entire hotel rented out and the entire convention center for this 4-day event. It was 11:30 PM on the first day when we got a call for a possible seizure in one of the hotel rooms rented out for the convention. We show up to a girl who is butt naked strapped to the bed via leather bindings, as well as a giant black metal vibrating dildo who is actively seizing. The girl is seizing as well as the dildo inside her. Her sexual partner called us and bailed. He neglected to remove the dildo as well about a dozen other various sized phallic objects. My partner worked on getting an IV in her while I untied her and removed the massive dildo from her. We got some versed in her which stops seizing and she was okay, but absolutely nuts how we found her. TL. Doctor found girl at anime convention with a massive vibrating dildo in her who was actively seizing. Burning Man 2017 was my first, and probably last, burn. A dude that was hanging around my friends sprinted, vaulted, dodged his way past numerous security professionals and managed to run into the fire. He died as tens of thousands watched. 2017 was a bad year for traumatic deaths accidents at BM. Not an M's, but on the Woodstock album, there's an announcement. Bugsy, please report to the medical tent. I know that Bugsy, he was a family friend. Whoever was in charge of the medical tent heard about Bugsy, and he spent a lot of time helping diagnose symptoms and talking people down from bad trips. Bugsy was the go-to guy in town that vetted every single drug that entered that town. Until Bugsy gave the okay, nobody would touch anything. If Bugsy said it was not legit, not only did no kids use the stuff, but the older guys would run that dealer out of town for trying to hurt people. We all looked after each other in those days. Good times. That is freaking awesome. Every festival needs a Bugsy. I'm just a festival goer, but shout out to all the 110-pound white girls that take too much of something within the first 2 hours of the festival day one and get escorted out on a stretcher. It's really hard to know your limit beyond 0 at 110 pounds. Been there. This is a very famous copy pasta, at least in the music festival scene. At Echo Project I watched a Wookette giving birth during the Jizza set. I was just peeking on some 2C. People were trying to get medical help, but they hadn't arrived. Some other Wookette claimed to be a midwife and was coaching the woman through this. Her Wook man is standing there shirtless and spun like top, just making these weird sounds while he is crushing his beer can and spraying Coors Light all over everyone. He looked really anxious about the whole thing, grabbing his face and just making grunts and stuff. The baby's head starts to crown and the medics still haven't arrived. This is where it gets crazy. It was so freaking dusty out there and the baby and all the surrounding fluids were immediately muddified by the blowing dirt. I mean, it's freaking gross. All of a sudden, this freaking kid, probably 19 or 20, in his oversized neon, flat brim LRG hat, runs up yelling welcome to the party B before he blows a huge plume of smoke right in the baby's face, while the umbilical cord is still attached and crap. The smell was unmistakable. This baby had just been deemstered. He must have pulled the hit from a bong. BC it was monstrous. The surrounding crowd dropped their jaws, and someone tackled the kid as he starts to run away. He didn't make it more than 10 feet and he was probably blasting off about now. The mom is clutching the dirty baby and trying to calm it, though, strangely, the baby was not crying. Tripping balls I guess. And while the dude is getting screamed at, the dad suddenly pounces into action. He jumps on the dude and starts smashing said Bisco kid's face with a crushed up beer can, of which he seemingly just can't let go. The Bisco kid is kicking and trying to roll out of it and the Wook dad grabs the kid's hair one hand. He finally let the can go and shoves his other hand halfway inside the guy's mouth. He is pulling his mouth open and rips his cheek open. Repeat. Rips his freaking cheek open. There is blood everywhere and the dude lets out this Braveheart-like scream as he gets pulled off by the folks around him. Blood all over Bisco kid's face. Shirt and formerly fresh flat breezy. The cops medics arrived about that time and took over the situation. Crap was crazy as heck. Welcome to the party, B. Waiting in line for a shower. One of the showers went out of order because a woman was blasted on something and was rubbing herself raw. I didn't know that's what was going on till a health and safety volunteer I'm friends with told me later. I did Glastonbury a few weeks after qualifying as a paramedic. First night shift was with a local GP as my driver. He'd been to every Glastonbury, a true gentleman, and suggested watching the sunrise from the stone circle. The next night I worked with a small town EMT who was frightened of people that were high and wanted to take everyone to hospital if they'd so much as been around drugs in the last 72 hours as they might be spiked and OD. Best patient was a girl so wasted on ketamine she'd not noticed her ankle was badly broken. She'd sprained it on Friday night, took it easy on Saturday but dosed up with ket on Saturday night, to the point she was dancing on it. She got a ride to hospital. Sounds like Ket girl just did the anesthetist's job for them. Not an EMT but at Lollapalooza last year I saw this girl climb a tree and was jumping on a branch like 20 plus feet up. Then she just laid down and straddled the branch, arms and legs hanging off, thinking she finally passed out, only to surprise us when she came back to life and started jumping on this branch again. Then quite expectedly, it broke and she fell, hit the ground hard. I don't really know what happened after that because my vantage point wasn't great, but I do remember seeing her and thinking that she was on some kind of trip. Girl straight reverted centuries of intellectual evolution. Obligatory not an EMS. At Download Festival this year in the UK, one of our group headbanged so hard they gave themselves a bleed on the brain and had to have an operation. Unfortunately, the symptoms were very similar to just being insanely drunk, and after spending 3 hours passed out in the festival village with the paramedics, the rest of the group being quizzed about anything we had taken. 100% nothing but alcohol as far as we were aware, and 2 days in the first aid tent. It wasn't until their vision started blurring and words slurring that they went for a CT. EMT here. This literally happened last week. I was working a rave and I had a patient who took a lot of MDMA. I mean a lot. He ended up being escorted up to our first aid room by security. When he got poked for a blood sugar, he ended up on the floor kicking his feet and flailing his arms around. He was being super combative with us to the point where he wrapped his arms around my neck at one point. My partner at the time called for more security, PD, and an ambulance. Me and one of the other security guards had to restrain him on the ground until the medics got there. I was sweating like crazy trying to keep him held down. Paramedics came and gave him something to calm him and took over care. That was a fun night. Here's a good recent story for ya. Mid-July, working as a paramedic at a festival. Pretty quiet all shift. Finishing up at midnight and getting excited to go party with friends. A call comes in over radios that security is chasing someone down who is in full drug-induced freakout. Start heading that direction in case medical needs to get involved. Arrive on scene to 6 people trying, not very successfully, to hold down this shirtless guy who is thrashing on the ground, absolutely losing his mind. Polypharmacy on board. No further info on what he's ingested. Dude and screaming at the top of his lungs bloody murder. The only part of him not being held down is his head. Starts to bash himself face first into the ground while chewing through his lip tongue. I'm now holding his head with all my might while he's trying to bite my fingers. Crappy latex gloves I have immediately tear, so I'm covered up to the forearms in this dude's sweat and blood. Managed to get something soft under his face so he can't pancake his face anymore while prepping drugs for sedation. Managed to sedate and strap the guy down to a board where he had a nice little snooze at the med building until whatever he took wore off. Washed off. Clocked off my shifts and hit the dance floors. Festivals. Just 2 weekends ago I was at Rockagrass chilling on my tarp listening to the tunes when a lady 10 featuring in front of me starts screaming help over and over. Her 18-mo-old kid was choking, blue in the face, and his eyes were starting to roll back. I was an EMT many moons back, so I flipped him over and gave 4 back blows to clear the watermelon chunk he was choking on. Happy feelings all around. You saved a beautiful and innocent life that day. That's like all the karma you need. You can go rob a bank now. Not a medical person, but this story involves one. Does that count? Beach Fest 17. Last day, my buddy and I were about to leave. We were actually going between campsite and car, packing our crap away in small trips. There's 7 or so of us standing around at this gate waiting to be driven to the car when this hippie looking dude walks up and asks someone for a smoke. One kind guy obliges, and then this dude just starts talking. You know how a stereotypical hippie will start telling a story all slow like, and drags out the word Mariah? He did this. Classic. Nobody asked him to start telling this story. He just went for it. Story goes. From perspective of hippie guy, at festival whatever in the 90s, I was working as a bodyguard. My tent was near the medical tent, so I saw some crap go down. Once, these 2 dudes on LSD, one a skinhead, the other a black guy, were stuck together in a medical tent, both having a bad trip. They were yelling at each other, but they were high, so they kept forgetting why they were so mad. So the yelling was just circles of noise. Eventually, medics come in and try to stabilize both guys. But if you've ever done acid, you'll know that medical questions aren't how you help alleviate a bad trip. That's gotta come from a personal, not professional, side. So anyway, I see this going down, and I step in and convince the medic to let me take over considering I've done acid plenty of times. So I get in, and I start asking very basic questions to these guys. Where are you from? What's your name? Are you high? The black guy says yeah, I just wanted to listen to Metallica live for the first time in my life. The skinhead responded, dude, my favorite band is Metallica. Eventually, these 2 start getting over their fight and start bonding over their favorite band. It was like magic. In an instant, once these 2 found something in common, became not only amiable, but friends. And I mean good friends. I saw these 2 attached at the hip for the rest of the festival, both singing and dancing side by side, watching Metallica headline the festival. It was a surreal moment for me, too. If you've never seen hatred get subdued by pure kindness and love, it's a magical experience for everyone. We all learned a lot that day. I haven't forgotten that hippie guy. He was strung out, but he was a good soul, and he could tell a good frickin' story, haha. I went to Lollapalooza 2006 to see Queens of the Stone Age and the Red Hot Chili Peppers when I got heat stroke. Queens was playing right before the Chili Peppers and me, my friend, and his girlfriend decided we wanted to stake out a spot near the front where we would be able to get a good view. They had these fences going up to middle leading to the soundboard, so we staked out spots against it to have something to lean our backs against. We tried to bring in a giant jug of water, but security wouldn't let us. So we each bought one small bottle inside and decided to take turns filling them up at the water fountain. Most of the day was fine, but it was one of the hottest days of the year and it got brutal. Eventually the crowd around us got so big we couldn't walk to refill our water. A bunch of us sat around in a circle talking and this security guard with a ponytail and handlebar mustache walked up to us and said if any of us had any weed to trade he would hook everyone up with waters throughout the rest of the day. We all looked around giving each other, is this guy for real looks? I had weed but no way in heck was I trusting this shady frick. The day went on, but being out under that brutal hot sun was definitely taking its toll on us. We got water sprayed on us occasionally from security people but it was not enough. Costa was awesome and we were looking forward to the Chili Peppers. About one song into their set my friend's girlfriend was feeling like she was going to faint. So he told a security guard and they pulled her out. A couple of songs more and he looks at me and asks if I'm alright. I didn't want to say anything, but I felt awful, like I was gonna pass out and seeing things like I hadn't slept in days. I tell him I'm fine, but he looks at me and says, dude, no you're not. You should go too and have them look at you. I eventually caved and got pulled out as well. The security guard walked me down the path to basically the front of the stage and then off to the right to a patch of grass with a bunch of sick people. He sat me down and told me to wait. About a minute later some lady comes to check on me. She points a flashlight in my eyes and says, watch her take. I told her nothing because I hadn't taken anything. Come on, watch her take. I told her again, nothing. I've been in the freaking sun all day. She says then signals over to someone who comes and dumps a bucket of ice water on me and gives me a bottle of water. I just sat there, soaked, for the rest of the concert and then try to find my friend and his girlfriend after the crowd had cleared. I finally find them and they ask me why I'm all wet. I ask why isn't she wet? Even though we both got taken away for the same thing I was the only one that had a bucket of ice water dumped on me. She got a bottle of water and to peacefully enjoy the rest of the concert from the side. Still pisses me off to this day. Have witnessed a number of people seizing up. Really tough to see, wouldn't wish that on anyone. People drinking too much, taking too much. Take your time, be smart, hydrate, know what you're ingesting. Got nothing to prove out there, moderation is key. I was at EDC Vegas and stopped by the med tent with my boyfriend so they could wrap his shoulder that he hurt in the pool the day before. We were outside waiting to go in and saw 4 guys trying to drag their friend to the tent. The dude was on something I've never seen before. He was jumping up and down aggressively and shaking his head and looked like he was having a seizure. All 4 friends were having an extremely hard time getting him under control. Once he realized he was close to the med tent, he somehow broke free from the 4 guys and booked it back towards main stage. His friends took off after him, along with 2 cops. They managed to get him close enough to the tent and a med person ran out and literally stabbed him with a needle, some tranquilizer, to which he immediately collapsed and finally got carried into the tent. My boyfriend and I just stood there staring at this whole ordeal in shock. I have been to a lot of festivals and have never seen someone behave like that, even on multiple party drugs. I have no idea what he was on, but it was terrifying. The guy wasn't even big, probably 5'7" and not more than 150 pounds. Yet it took 4 friends, 2 cops, and a tranquilizer injection to make him stop. Keep in mind this was like 2 hours into the festival on the first day. Probably got slipped PCP honestly. Actual festival M's worker here. In brief, we get tons of crazy stories and they become routine. But the first I remember was the guy who was found naked but for his sunglasses running around Bonnaroo, attempting to, non-violently, evade M's. He came in restrained to a backboard, equally confused, energetic, and friendly. Managed to flip himself and the board off of a cot, talked to all the other patients, etc. Woke up unaware that he was naked. We'd covered him up, obviously, with no memories of the night before or where we left his clothes. Sent him on his way with his sunglasses and a blanket. Shout out goes to the young lady who did the same but was covered in only glitter, and was absolutely sure we were aliens. Tried unsuccessfully to climb a fence before getting a sedative to the butt. Actually M's at a music festival here. Definitely not the craziest thing, but it was one of my favorite calls I've been on, because no one got hurt and I was brand new. Somebody calls me over because some old guy is having a heart attack. Immediately my fresh out of school brain leaps into action and walks over to this older guy. He doesn't seem to be in any apparent distress, but he says he's dizzy. Going through all my textbook questions, I eventually land on what he last ate, as he tells me it was the chocolate cake that was being passed around. His eyes go wide and he stammers, "Am I high?" "Yes, yes you are. I haven't been high for 40 years. I feel like such a square." It was just so fun to watch the realization come over him and to be there while he decided to make the best of an unexpected trip. Paramedic here. Was working standby at an EDM type concert, rave. End of the night I had to wrestle a gay dude wearing only a jockstrap and butterfly wings out of a water fountain. Some bad XTC was going around. Must have been cut with an upper or bath salt type deal, as I was working with a whole bunch of insecure dudes that didn't want to catch the gay. They elected on me, the queer dude, to get this guy out. 4th of July festival. We get a call for a fight. No lights or sirens needed except to disperse the crowd a bit. On the way we get upgraded and police are asked to join us. Unfortunately they're currently dealing with a higher graded call. Just before we arrive we're informed that one of the fighters has bitten 2 people and is screaming that he has hep C. This is very serious. So on the way over, stuck in 4th of July traffic we run into some local cops who join us on our way. Food smells good. Music is fun. We arrive on scene. First thing we see is a big dude hunched over by some trash cans huddled over by 3 women. I didn't see anyone else out of the normal at first. We approach and ask how he's doing. Says something along the lines of "that guy attacked me. He's got hep C." We turn around and see a particularly sweaty dude in a wife beater, a pair of what could best be described as triangular denim, jean shorts and lastly a stained pair of boxers. Of course these were basically fully exposed. As we walk up to this upstanding citizen he makes a break for it and our lovely officers in tow join him until they all make it to the ground. This is sadly in front of many young'uns and elderly folk just trying to enjoy the music and fireworks. Once on the ground he gives up and his girlfriend shows up crying asking what's happening, what we're doing, etc. We ask him about the altercation and if he has hep C. He's unclear on the disease, but very clear that the other guy started it and is completely at fault. After transporting the 2 we got word that the biter did have hep C and a while later that the bitten was lucky enough not to have contacted it. Guy sitting in a chair out in the middle of a field. Told me he ate a Rice Krispie treat with blue specks in it. Found this out later. Refused to move, get out of the sun. It was at least 100 degrees outside. Thought he would float away. He had a death grip on that folding chair. We finally just picked him and the chair up together. Took him to a medical tent. Sorry, not EMT, but my first year at Okeechobee 2017 I had a chick jump in with our crew on the first day after she left hers cause they were doing hard crap. Security was super lax. She failed to mention until that night that she was diabetic and left her insulin at her old camp. She insisted that she would be fine. We go out and party the first night and had a blast. Woke up the next morning and she was delirious and forcing herself to vomit. WTF. I asked if she needed to go to the medical tent, which was a 5-minute walk, but she refused. Luckily some volunteers were passing in a gator and asked if she needed help. I told them her problem and they took her to the medical tent and I told them I'd come check on her in an hour or so. I knew she was in good hands and I didn't want to miss out on some of my favorite sets. Sorry if it seems selfish. Later on I go to the tent and what do you know, she had freaking vanished along with the crew that picked her up. I ask the workers that are there where TF she is and describe her, but no one has seen anything. Crap, we basically lost her and didn't hear about her the entire night. I woke up early the next morning groggy after a night of fun and used the pisser about 200 meters straight down from our camp. As I'm walking back I see 2 cops and 2 older women standing at my camp where my dumbass friends left their drugs and paraphernalia out in the open, mainly hallucinogens and whippets. I'm like frick thinking I'm about to get arrested or some crap when one of the cops turns to me and asks, "Are you the silver potato?" to which I replied like a smartass who's asking. They told me I wasn't in trouble or anything and then something weird happened. The lost chick's mom runs up and hugs me thanking me for saving her girl, and I'm like, the frick? Apparently she was in such terrible condition that they rush her to the ER and she was in the ICU recovering. I told her it was the crew that saved her, but she wouldn't have it, lol. Her grandmother was the other woman and they were all super nice. We packed up her stuff and gave it to them and they went on their way. I kept in touch with that chick for a while and not even half a year later it turns out her mother passed away. I wasn't going to ask how, but that was the strangest experience of my life. TLDR. Adopted a chick with diabetes and no insulin. She went to the ICU. Her mom showed up and thanked me. Her mom passed away a few months later. Doctors, what was the best excuse you've heard for someone having something stuck in their butt? Had a guy with a screwdriver up there, handle first. He was honest. Said the wife wanted to try something new. Why the screwdriver? Something shaped like a dong would have been gay. I always thought that was a real weird place to draw that line. I guess you could say he got screwed. I've got this one. Not a doctor but Tridge. Guy comes in, walking, kinda awkwardly, doesn't take a seat. When it's his turn, he's called up to Tridge and again refuses to sit. What brings you in today? I said. I've lost a glass. You know, like a tumbler. Shuffles. Okay. So, why are you here? Well, we had a party that got out of hand last night. I was cleaning the house this morning and I noticed one of my drinks glasses was missing. And I think it might be up my butt. That's it as far as explanation. But sure enough, there it was on x-ray. Rim side first. So after it disappeared up his butthole, it basically filled itself with crap. Now, anytime people that know the story ask if I've seen something they've lost, I ask if they've checked their butthole. My friend is a nurse. She told me about a guy who came into her. He claimed to have fallen out of a tree and a branch went right up his butt. They x-rayed him and he had this perfectly round wooden rod up his butt. When they removed it they saw that it was sanded, painted and primed. That branch must have come from a genetically modified species of tree, lol. Crazy how the human body do that. My mom was a nurse and always remembered the guy whose wife was out of town, so he was cooking naked and slipped and fell on a potato. I am a nurse, a male as well. Guy came to my hospital with a cue ball stuck in his rectum. Said him and his wife were having sex and this happened. Made no excuses and showed no shame. A doc was unable to remove it with forceps and he had to get anesthesia to have a minor surgical procedure to get it out. My job was basically to just go through a pre-surgical checklist and send him on his way. When I'm done he shouts excitedly, "Alright, let's get this ball rolling." I almost died laughing. It was near the end of my shift and I always wonder what happened to him. I'm sure he did fine and is back to having amazing kinky sex with his wife. Alright, let's get this ball rolling. This guy has hero material. Had this elderly guy come in with a cucumber up there. First month of residency. So my attending asks, "Why did you put that up there?" Guy, "Dead's normal." Says, "Well, it was just like every Tuesday. I woke up, made some coffee, and sat on a cucumber." Stifling laughter, my attending just said, "So you shouldn't do that anymore." He says, "Okay." We removed it and never saw him again. Guy told me he was constipated, so he stuck the broom handle up there to break up the poop. I almost believed him. Edit. It was half of a broom handle, cut off and wrapped in electrical tape, all the way inside his butt. I'd believe that. People are stupid. A college friend who is an OR nurse said the best thing she ever witnessed was a small snow globe with the message "World's Greatest Dad" on the inside. Saw someone with a remote control stuck way up in their colon. She said she was getting herself ready for anal sex with her boyfriend and then it got stuck. The kicker was that she showed up to the hospital with her boyfriend and her husband in tow. I am really curious as to how that conversation went. My ex is a nurse. One night she sent me a pic of her computer of what she was working on. 16-year-old male brought in by his mother, shoved a sausage up his butt and lost it. Imagine the embarrassment of telling mom, "Hey mom, I lost a sausage in my butt. Can you take me to the ER?" Frickin' kids. Paramedic. Here. Had one guy tell me he slipped on a banana peel and landed on the upright vase on the floor. He then proceeded to produce a banana peel for good measure. The fact that he genuinely had a banana peel made me laugh more than the entirety of this thread. Not in butt, but a vagina. I was doing my clinical rotation in 3rd year. Did a cervical assessment on 36W pregnant woman who thought she was in labor, painful cramping, plus discharge. I found 8 cloves of garlic. She thought she could avoid group B strep with it. She read it online. She thought they would dissolve. 1. You can't avoid GBS like this. 2. They turn to slimmer mush bulbs. They don't dissolve. She was not in labor. She was responding to an infection. A nasty one. She was admitted for fluids, object removal, meds, and monitoring of fetus for treatment overnight. I finished my 24/8 shift before the next OB wrapped up. Cramping stopped very soon after we got it all out. Last I saw her she was just feeling sad and dumb. I felt really awful for her. She was trying to do the right thing for her pregnancy. GBS. Gut bacteria found in 1/3 of adults at any time. Some cow tries screen for its presence because in rare cases it does nasty things to baby if they get colonized at birth. I had a patient who was trying to treat bacterial vaginosis with garlic cloves. You have a special knowledge of how thankful I was she'd made a little cheesecloth pouch for it first. All came out in one gloriously funky chunk. Garbage had to go out immediately. Guy came in with a cordless phone up his butt, like one of the old school ones from 15 years ago. He said that when he was in the kitchen bending over opening the oven door, someone threw it through his open window and it just went right up. When I was a student working in an OR, a guy came in with an unraveled wire hanger stuck and hooked up there. He said he was trying to fish out the vibrator he lost. It always boils down to the person accidentally sat on it. The best my dad saw, a former emergency doctor, was a young guy who accidentally sat on a giant tub of Vaseline. Accidentally. I asked how doctors record that in their patient files, and the common way to do so is to say the patient claims to have sat on X object. There was a news story in my country. A man went to the ER and they discovered that he drunkenly put 2 hammerheads in his butt. His reasoning being that he ate a jar of preserved cherries with pits and then had abdominal pain and wanted to smash the pits. Took me a few seconds to realize you didn't mean tiny sharks. Related. Guy puts a vibrator, one of the massive cordless one types, wire up there, like a mega seed, and it gets sucked into the sigmoid colon. When he gets to me in the ER, I ask him how he was feeling. He answered, "Well doc, I'm way better since the batteries died. Made my night. I've been trying to entertain the medical staff since my open heart surgery. Was having problems with low blood pressure. It hit 90/58. I got the ringing in my ears. Everything went red, and I passed out. Oh no. Yeah, but my carpet smells fantastic." A nurse. I tried to dig something out of my butt with a barbecue skewer. Skewer got stuck. Ripped a hole in his intestines. He waited so long to come in he was septic. One stat or visit and an I could stay later. Please don't call my mom. Guy was tripping hard on LSD. I stuck it up there on purpose and now it's stuck. Please help. It was a perfectly honest and valid reason for have something stuck up your butt, and we helped. No further questions needed. Now I'm interested how often that happens. I mean the honest answer. Not an excuse, but a medic told me that they have contests about what is the most unexpected thing they pulled out of butts. The winner was a guy that put an electric Christmas decoration, the ones you wrap around the tree. In her own words, the legend doesn't say whether he plugged it or not. I should have asked what the excuse was for that one. So I actually once did fall naked in my bedroom and my butt cheek smashed hard onto the end of a small dumbbell that was angles up at 45 degrees. I'm coming to realize after reading all of this that had it hit the bullseye, no one would have freaking believed me. My cousin who is a doctor once told me that when you really do fall on something and it goes up there, it's not pretty. There is tearing and overall injury. When there is no injury where it went in, you know it was likely eased in, and that's how they know the I fell on it story is bulls. Presented at her in Sydney with carrot stuck in the ass. Doctor, what happened? Patient, I heard a noise in the garden. Went to investigate. Slipped and fell over. Carrot went up my bum. Doctor, carrots grow upside down out your way, huh? Friend's mum was a nurse. A man came into her with a cucumber in his bum. Apparently he was vacuuming his fruit shop in the nude and slipped over. Worked on ambulances, not a doctor. Mostly bottles or vegetables. The aubergine was the biggest, but potatoes and carrots seemed to be popular. Ketchup, mayo and glass cola bottles were common at one point. Also one butt plug and a toilet brush. The last two were honest and very distraught. Others all had naked gardening stories. There's an even worse question you haven't asked, which is for things people have shoved up their urethras. Only men in my experience. My brother was a triage nurse and examined someone that came in with a Barbie doll up their ass. Don't know if they were male or female though. There was a guy who would often come to my friends for Barbie head removals. He had several Barbies he kept in his jacket, held in place by loopholes he had sewn in. They always knew how many heads to look for by how many heads were missing from the Barbies in his coat. My sister is a surgical nurse and a guy came into the hospital with a pool noodle shoved up his butt. It was so deep that they had to cut open his abdomen, intestines and colon to cut the foam out of him. He said he fell on it while swimming nude. But when they cut him open, it had a condom stretched over the end of it. When they confronted him, he said, "Please don't tell me, wife." At least he was practicing safe sex. The best one I've heard is a priest who had peeled a potato and left it on the side for his dinner. He decided to hang the curtains back up while nude and fell off the stepladder onto it. It was in the UK paper years ago. If I find it, I'll post the source. What I love is that some poor bloke, just one, did fall on something naked and no one is going to believe him. I went to med school in the deep south. Burly, middle-aged southern gentleman showed up in the ED. Chief complaint, rectal pain. After a full history and physical examination, couldn't ascertain the case of his pain other than him saying feels like something's up there. We decided to start with some x-rays. Before we obtained them, he says, "Alright, I'm gonna be square with you. I was walking down the street, minding my own business, when these thugs jumped me out of nowhere and held me down and stuck a cucumber up my butt. Please, you got to get it out." I immediately went to get my attending, one surgical consultant GI. Consult later. A cucumber wrapped in a condom was extracted from this man's rectum. I was walking down the street, minding my own business, when these thugs jumped me out of nowhere and held me down and stuck a cucumber up my butt. SMH, look how far America has fallen. We have gangs of thugs going around putting cucumbers in people's buttholes. For though I laughed so hard at this comment. Friend is a stomach surgeon, so always gets called in to pull things out of asses. He has loads of stories, but the one I remember is a guy who had a glass ketchup bottle up his ass. He'd claimed to have returned home with his grocery shopping, realized he'd lost his keys, so put shopping down and attempted to climb through a high window. He slipped, fell backwards ass first onto his groceries and SHLUM. The ketchup bottle just shot up his a-hole. Ignore that guy was presumably not naked at the time. After removing it at the hospital, my doctor friend said that's strange. The ketchup you bought is only half full. I think the worst thing is that it suggests he was gonna eat the rest of it another time. A light bulb. You could always tell when someone came into the ER with something lodged in their rectum because everyone would be standing around looking at the x-ray. It was still in perfect light bulb shape. I have no idea how the patient got it up there without breaking it. I'll tell you what, they're bobo. Either the kid's got a light bulb up his butt, or his colon's got a great idea. Dr. Cox had a patient who showed up with his soon-to-be ex-wife. They were reconciling at a nearby motel. She convinced him that if he loved her, he would let her put a dildo in his butt. Only it wasn't a dildo. It was a vibrator without a flared base. Rule number 1 of anal play is make sure that it has a flared base. Rule number 2 is nothing sharp. The whole thing went up there and he couldn't get it out. I had to take it out under anesthesia. She felt awful and was crying the whole time. He was a very blue collar, normal dude and she was dressed in very fancy clothes. An unlikely match in my mind. He was just happy that they were at my urban hospital and not the uppity town about 15 miles away where they lived. I often wonder what became of them and their marriage. I feel like nothing sharp should be rule number 1. Shudder. Trying to reduce prolapsed hemorrhoids he developed after a long, arduous poop doctor term. Of course, I wondered how a vegetable peeler was the most available object to be had in the bathroom. The vegetable peeler became stuck, as these things tend to do. However, this was the kind with slits in the plastic and his formerly prolapsed imago tissue protruded into the slits, making it impossible to remove, also cutting off blood supply which made them necrotic by the time we went to the OR. What kills me is that his next move to try to remove this object from his anus was to try to cut it out with scissors. OMG. It was horrible. A jagged piece of plastic wedged in, horrifying and, indeed, quite memorable. And that's officially the worst thing I've ever heard of. My god. That's freaking horrifying. Not a doctor, but I don't know that I'll have a chance to share this again. Growing up there was an urban legend about a local bloke that had to have a butternut pumpkin, squash, removed from his ass. Fast forward 25 years and I'm reading the book written by my dad's liver specialist, and lo and behold, it wasn't a legend. In fact, an entire chapter was dedicated to gentlemen with foreign objects needing removal from ass and bladder. Just reading bladder made me cringe. I don't know how anyone can stick things up there. You asked for the best but I have the worst, but possibly the most honest response I've gotten. I was an EMT and ran a call at a methadone clinic. She was a 28-year-old female who had possibly OD'd. When we got there she was sitting on the ground completely naked. My captain asked what was up her butt, to which I responded quickly as trash bag sir. For some reason there was a contractor bag jammed right up her anus. My captain ordered me to remove it and it felt like I was a magician pulling a bunch of napkins out of a dove. Or whatever magicians do. She looks at me without a word, until I asked her why there was a trash bag up her butt, at which point she responded we didn't have a condom. This was my second week on the job. It wasn't an excuse and it wasn't the butt. A young lady in Riverside TX, very heavy M presence, was dared to stick a live catfish in her vagina. She shoved it in head first. Those who know catfish know they have very sharp dorsal fins. Well, the dorsal fins lodged in the walls of her vagina and became stuck. She came into the ER screaming in pain with a live catfish flopping all willy-nilly out of her privates. I wish I still had a copy of that X-ray. Well, my vagina has packed its bags and noped the frick out of this thread. I once had to take a guy to the OR to remove a cucumber from his rectum since it had migrated up further than could be extracted manually. I don't remember his excuse, but it had been in there for more than a week and when we took it out it had started to pickle. I am pickle shy. My grandmother used to be a nurse. Apparently back in the day, these kinds of stories were shared over fax. A hospital in network had a story about a patient's CC was abdominal distress. Radiograph revealed odd radiopacitors in pairs about 3/4 of an inch apart. Docs counted 3-4 pairs, couldn't figure out what it was. Exploratory surgery resulted in 4 Barbie doll heads in the patient's large intestine. After the discovery, patient stated that he had a fetish. He swallowed Barbie heads because he liked the way the hair felt on the way out. The radiopacities were the doll eyes. Apparently they used to be metal in the paint or something. Top comment after reading facts. Barbies are expensive. Did he recycle? This is eerily similar to another comment on here involving Barbie heads. Jesus Christ, how many people just stick random crap up their butt? A whole lot of sexually frustrated kinky people caught up in the moment of getting their rocks off without actually considering the potential consequences resulting in having to go to the OR for extraction, is my guess. I heard a story, probably made up, that a bunch of guys were hanging out and getting stoned while camping, or somewhere outdoors, when one of their members went into diabetic shock. His buddies knew he was a diabetic and realized what was happening but had no idea what to do about it except to get him to a hospital. Not a bad choice. So, they all piled into a car to drive him to a hospital. This was before cell phones. On the way they were arguing what to do. They felt he needed sugar, whether right or wrong that is what they decided, and they argued over how you get sugar into an unconscious person. Supposedly the doctors found a Snickers bar, or whatever candy, shoved up his bum when they examined the patient. I will say, if true, he has really good friends. Dumb friends, but good. 20 years ago, an ex was a nurse. A guy came in with a magic mushroom air freshener stuck up in there. He was embarrassed and did not even attempt to explain it. She said that when the doctor got it out, he said funny, "It doesn't smell pine fresh," and everybody laughed. I am kind of surprised that didn't lead to lawsuit. Taking the doctor to court would have involved explaining to the judge what happened. Yes, Your Honor. After the doctor put his medical degree to use by getting elbow deep in me like Jim Henson working Kermit, he made a joke and it made me sad. RN here. Had a Jehovah's Witness gentleman admitted to ICU with his bowels perforated. States he had constipation so he decided he needed a cleaning. He happens to do pipe work so he hooked some pipes up to the hose then inserted the other end in his rectum to just give it the ol' swish and dump. Burst his colon from the pressure and all the hard pipe crammed up his butt. Unfortunate thing was he needed a blood transfusion but oops. He is a Jehovah's Witness so no go. I learned then that they actually send a group of people to the hospital to watch you and make sure you don't stray from your faith. I always wondered what he told them. I learned then that they actually send a group of people to the hospital to watch you and make sure you don't stray from your faith. Jesus Christ. Frick them so hard. I worked on a surgical ward for a while and we had a few strange items. I can't tell you what their excuse was because we saw them post-operatively. One guy stuck not one, not two, but 3 snooker balls up his bum. One guy stuck a clay pigeon up his bum. That one was pretty impressive. One guy, 92 years old, tried to fish out a vibrator with a coat hanger. And my personal favorite, a guy stuck an old Nokia 3310 up his bum. They x-rayed him and took him to theater. They kept trying to fish it out but he kept getting phone calls from his mum wondering where he was. Every time she rang, the phone would vibrate further up his bowel. Remember how back in the day you could get those crappy $2 ringtones where it wouldn't sing the lyrics but it would buzz to the words and music? Guess what his ringtone was? Will Smith's Getting Jiggy With It. Thank you and good night. If I had a Nokia up my butt, the last place I'd want to go is the movies. A doc and a little late to the game here. I've lost count how many erectile foreign bodies I've removed. But there was this one kid, well teenager, he got a AA battery stuck up his butt. Told his mom that he had been experiencing constipation and thought his butthole was just too small for the poop to get through. So he was trying to dilate it with a battery. Yeah, okay. The kicker was that his mom completely bought this story, and she's there telling me how this whole thing happened to her precious, innocent son. My mum worked in emergency for a long time back in the 80s, and this is her favorite story, but it was a vagina and not a butt. A woman had used one of those wide, shallow face cream tubs as a diaphragm. Predictably it became stuck while doing the deed and she presented at the hospital fully honest about what she'd done. Anyway, they managed to remove it and then she asked for the tub back because it still had face cream in it. Emergency medicine physician here. On the flip side, there is nothing more refreshing to us than when people come in and are completely honest. Patient, I like to put golf balls into my rectum sometimes and I can't remember if I put in 3 or 4 but I only got out 3. Me. Perfect. You have a problem that I can solve. Let me order an x-ray and see if there is one more that I need to remove for you. Sounds pretty much par for the course. This isn't exactly what you asked for but a family friend is an endocrinologist and a surgeon. He has his fair share of oddities they have to remove. But what stands out to me is that he must have a few cases every year where the patient has no idea how the peanut butter got on their crotch or why the dog bit them. Way more common than it should be. I thought it was something out of the movies. The frequency of occurrence and confidence in lie always baffles me. True story, and not funny to this day. In high school, my best friend's twin sister got a frozen banana stuck in her butt. She was so mortified that she had her girlfriends attempt to remove it by squirting boiling water in her rectum with a squirt gun. Some of the material from the melted water gun was also found. She suffered burns so bad she was put on a special liquid diet and missed the final 2 months of school including graduation. Worst of all, it happened at spring break in Cancun. Her parents didn't truest the hospital but due to the severity, rather than fly her home, the surgery was delayed a full 24 hours until her parents could travel down to supervise. A student on the yearbook committee was almost expelled because on the page on which a picture appeared, he replaced the second digit of the page number with a small banana. This happened in a very small high school in the early 90s so I'm not afraid of someone recognizing the specificity of the story. Doctors of Reddit, what is the most mind-blowing recovery you've ever witnessed? Resident here. When I was a medical student on a cardiology rotation, we had a very nice 40 years old lady that was being treated for a heart attack, kinda young. But okay, this type of heart attack, deemed an NSTEMI, is the type where she did not have to be urgently rushed to the cath lab. So she had hers the morning after she was admitted, seemingly fine before going down. While in the cath lab, she spontaneously went into cardiac arrest. They got her back after 2 shocks, multiple rounds of CPR, and a round of EP. Usually, if someone is coding for a while, it doesn't look good for them. But she came back and was intubated, so it's more of a watch and wait deal after. Well, overnight, she self-extubated herself. When I rounded on her in the morning, she was awake and said she felt fine. Her only complaint was that she felt like she got burned on her chest, and that was irritating her a bit. Oh yay, that was the 200J of electricity going through you a few hours ago. She then went on asking when she was going to be discharged because she needed to go home and take care of her 2 dogs. The fact that she went into cardiac arrest in-house and in a shockable rhythm definitely helped her chances of a good outcome. But it's still one of my cooler stories. BC, contrary to what people see in the TV shows, people don't just wake up, eager to take on the day, after cardiac arrest. I had a guy like that. He rolled in with an NSTEMI and coded in the trauma room, was quickly coded and actually woke up asking the trauma nurse to stop compressions. I cared for him the next day after his angiogram and he told me that story. I hadn't before realized just how much he scared the crap out of the trauma nurse. Resident here. This one is more of a mind-blowing remission than an acute recovery. Had one patient in one of my internal medicine rotations in medical school who was admitted for hip surgery who was one of the nicest, sweetest people I've ever met. Her surgery was pretty routine and there were no complications. In her past medical history, she was diagnosed with stage IV endometrial cancer that had spread to her brain. Apparently she had undergone chemo, radiation, primary tumor resection, and surgery to remove the brain met. She remained cancer-free since that period. The fact that she had undergone that whole ordeal and appeared to be mostly healthy and was in remission from her cancer really blew my mind. Have seen a lot of remarkable recoveries back to baseline from people unconscious and intubated in ICU, especially in young people who have high physiological reserve to bounce back from catastrophic events, for example, thyroid storm, aneurysms, ketoacidosis. I'd say the most surprising recovery was in a drug and alcohol patient. Man in his 20s with a very difficult upbringing. Dropped out of high school at 15 and was just hooked on and alcohol since. Very expensive habits, so he'd commit crimes to fund the drugs. Get out of prison and back to us for rehabilitation. Commit another crime. A horrible cycle. He wasn't motivated to recover because he didn't have much of a life to return to. Serious health problems from drug use. Nobody would hire him due to his criminal record. Parents in prison. Also seemed mildly intellectually impaired, possibly from chronic drug use. He only had his girlfriend. Then his girlfriend died of a drug overdose. I thought he'd follow after because he was hanging on just for her, but he did a total 180. Booked himself into detox. Attended all his appointments. Got his high school equivalency. Stayed clean for years and got hired as a security guard. On discharge, he was with a new partner and they had a baby on the way. During his last appointment he dropped into the dollar store and had a bag with a stuffed elephant and pink blanket inside. Just wow. That's some will right there. Not a doctor but a nurse who worked in long-term care. I had a patient who was apparently actively dying. She had stopped eating for 3-4 days and was on comfort measures only. This meant she was receiving morphine every hour and the rest of her medications were discontinued, and she was only being fed and given water as tolerated. Out of nowhere one day she just sat up and said, "I'm hungry," and like that she was back to normal. She lived for around another year or so after that. Paramedic fireman here. Had a guy, 65ish years old, who dropped dead while on a treadmill. Leads showed asystole, which means dead as heck. Zero electrical activity in his heart. 1 round of CPR with 1 round of ALS meds. Goes into a shockable rhythm. Defibrillate. Shock. 1 time. Guy gets a normal heart rhythm back with a pulse. Loaded him up. Had a 5-minute transport. By the time we got to the hospital, this man was making jokes with us and would have walked in if we let him. This is not how cardiac arrests go. You usually die, and if you live, your quality of life after is usually greatly reduced if not negligible. This was absolutely incredible. As a resident, I admitted a patient for a COPD exacerbation. Pretty routine. What wasn't was her history. She had been discharged from the hospital 4 years before with hospice. She had biopsy-proven small cell lung cancer that had metastasized to other organs. Essentially zero survival, and she had gone home to receive medicine to make her comfortable. She hadn't taken any cancer treatment. 4 years later, when I admitted her, there was no trace of cancer. The only suggestion from the pulmonologist was her crack C habit must have been lethal to the cancer, or her body just found a way to fight it off. Basically, we don't know how, and her odds of doing it should be about 0. Doctors hate her. She cracked the code. Sorry, I am not a doctor, but my brother had been given hours to live 3 times during his battle with cancer. I flew to see him and say goodbye all 3 times, and another 20 odd times to give moral support over the 2 years he fought. One night in the hospital, the doctors told us to say goodbye as he had only hours to live. We all fell asleep holding his hand, and at 6 AM I opened my eyes and listened to see if I could hear breathing. It was quite dark, and all I heard was my brother's voice saying, "Holy shit, I am still here." He lived for another year. Holy shit, I am still here is a great quote. I'm a patient, not a doctor. I was diagnosed at 22 with lupus and got acutely sick very quickly, which is a little out of the ordinary for the disease. Long story short, it's almost killed me a few times, but I'm lucky enough to call myself healthy for the time being. I've had a lot of doctors and met a lot of rounding med students since I'm a fun teaching case. Anyway, a couple years ago I was out with my daughter at a park and I ran into the doctor who originally diagnosed me forever ago. I was acutely ill at the time I met him and my prognosis was pretty grim. I hadn't seen him in over 10 years. He hesitantly walked up to me and asked my name and then yelled, "Oh my god, you have a daughter." Honestly, I have never seen a grown man so excited in my life. He was almost giddy. He wanted to know everything about how I had been doing and just kept smiling when I said I was married with kids and had been feeling good for the past few years. It was such a chance run-in, but I'm so glad he got to see me doing well, since he had seen me at my absolute worst. Makes me smile just thinking about it. AWW, that's so cool. It makes me all silly to hear of the doctors getting all cute because they want you to be healthy. Not a doctor, but this is my mom's story from a few years before I was born. She was driving home during a really bad snowstorm. She lost control of her car, swerved into the opposite lane and got T-boned by a pickup truck. The truck hit her car so hard, the driver's portion of the car was pretty much all that was left somewhat intact. My mom sat there lifeless for 30 minutes before anyone even called for help. Rescue had to use the jaws of life to get her out of the wreck and rushed her to the hospital. While in the hospital, doctors told her family that they've done all they can, but all other patients in situations like hers either died or were comatose for the rest of their life, and she probably wasn't going to make it. Soon after that, her blood started to coagulate, and her road to recovery began. She had to learn how to do everything again. Talk, walk, hold her head up, feed herself, clean herself, dress herself, etc. To make a long story short, after a year, I think, she went to the house of the head surgeon who operated on her and introduced herself. The doctor had to excuse himself for a while so he could gather his emotions because he just couldn't believe that my mom made the recovery she did. She doesn't even look like anything happened to her, but since her accident she has lived with a quarter of a lung missing, 1 kidney missing, double vision, and partial loss of feeling on her right side. Other than that, she looks and acts perfectly healthy. 4 years after her accident, she gave birth to me. I think she's a walking miracle and she's the strongest person I know. Dang, this reminds me way too much of my own mother's accident. That kind of hard hit has lasting effects, and I'm dang proud of both your mother and the surgeon for keeping her alive. My mom crashed on black ice and broke 2 many bones and received a TB. Medics thought she was a DOA. 19 years later, and she's still kicking. Not a doctor, but a relative. My grandma ended up in bed for about a year when she was in her mid-70s. She had been declining for a fair while, and just kept getting more and more medication to take care of her different illnesses and discomfort. I went up there 3 months before this and I was sure I wouldn't see her again. She was almost comatose, just lying in her bed, barely being responsive. At one point my 7-year-old second cousin randomly overhears my mom telling my aunt that grandma started on yet another type of medication. Far into double digits. 7-year-olds start crying because apparently she thinks that medicine is making grandma more sick, and every time she gets more pills, she gets more tired. My mom and aunt comfort this poor kid, telling her that it is not the medicine that is making her sick and whatever you tell a 7-year-old to calm them down. My mom is a nurse, or was back then. She is retired now. She worked with her best friend at a smaller private hospital in Denmark, and a week later in the lunchroom she is telling her friend the story about my cousin. The in-house anesthetist picks up on the convo, asks about what type of medication grandma is on. Mom starts mentioning the one she remembers, which really gets this guy's attention. Basically my mom names a chain reaction, like medicine A has lack of energy as a side effect and another side effect, which is then treated with B that causes lack of energy and another side effect that is then treated with C, etc. So basically if grandma didn't get A, she wouldn't need B, C, D or E, and that is just the 5 medicines that my mom remembered off the top of her head. Mom gets a list of all the medicines together for her colleague. Apparently him and his doctor Mrs. went over them as an after dinner activity, and the next morning he had a 3-page letter written up that my mom could give grandma's doctor, arguing why 25 out of 28 medications were at best unnecessary if not harmful. Mum got the next day off, drove 450 kilometers to see grandma's doctor, showed up without an appointment, pulled a Karen, got to see him, showed him the letter, and half an hour later left with a new medicine schedule to step grandma out of 25 different medicines and half the dose of the 3 remainings. 2 days later my grandma got out of bed for no apparent reason for the first time in 6 months. 2 months later she was walking the dog and baking again. 15 years later grandma is still alive. She is missing a leg now, and 4 years ago she moved into a retirement home with my grandpa. I haven't seen her for 3 years, but she is doing good. She ended up getting compensated by the stated, can't remember the figures, but it was the maximum amount. Mind you, not that high in Denmark. For some reason the phrase pulled a Karen is utterly hilarious to me. Glad to hear grandma is doing great. Cardiac care nurse here. Got called to the ER to assist with a cardiac arrest of this patient in his 50s. He had a delay of 10 minutes, no oxygen to his brains for 10 minutes. The EMT already tried reviving him for 45 minutes on a flatline. After 15 minutes the doctor said, last check before we declare this patient deceased, and when we did he actually had a pulse and a decent rhythm on the monitor. Mind you, we use an automatic CPR machine so we don't have to do manual compression, so we had to turn off the machine to check. He got wheeled to the ICU, ended up on the coronary care 2 days later. Pretty confused I might add. And a week later he walked out of the hospital when the doctors discharged him without any brain damage or visual physical damage. Reviving him for 45 minutes on a flatline. Holy crap, they were determined. Good for them. I had a patient during med school, 19-year-old guy who had a history of his aortic valve replaced because he was born with a bit of a funky bicuspid aortic valve. Well, when I saw him in the cardiac floor, he was walking, talking, totally normal except for a bit of weakness on one side, pretty much just on that floor for more monitoring and treatment for a vegetation on one of his valves. Prior to that though, he'd arrested in the field. EMS got called and did CPR for 30 minutes. Got circulation back, took him to the ED where he arrested again. They got him back and took him up to the ICU, intubated on pressors. He woke up, got better, and got transferred to us. One of the ICU attendings that took care of him stopped by and just kind of stared at him and said, "You were dead." I think that was a huge win for him. I was an intern working in the MICU during flu season. An elderly woman came in with respiratory distress due to the flu. She was already in bad shape prior to this, COPD, heart failure, etc. She was subsequently intubated, started on bedside dialysis, went into liver failure, developed an allergy to heparin, to name a few. She was maintained in a medically induced coma for about 2 weeks because she could not be extubated safely. Long story short, after about 6-8 weeks at the hospital, she went to a rehab without needing a trach or dialysis. I'm still surprised how she managed to make it out. I'm a rehab doctor, so this is right up my alley. I saw the guy who was impaled by a 2x4. It literally went through one side of his abdomen and out the other. Somehow, it avoided his internal organs and the surgery team was able to safely remove it. He got discharged to rehab service a few days after admission and we discharged him home a few weeks after that. Basically a normal guy with some residual pain and new scars. Typical, not a doctor. And not mine either. My mom was driving someplace on the highway, and it was winter. She started seeing semi-trucks on the side of the road, having slid off from the ice. By the time she decided enough was enough, it was too late. She hit black ice and slid into the opposite lane, straight into a semi going 60 miles per hour. Rolled down the side of the semi, and somehow ended up with both the cab's landing leg and her van's engine in her lap. The entire back half of her vehicle was sheared off behind the passenger and driver's seats, ended up in the median. The first person there took me into their vehicle to keep warm. I was a year old, saved by the blanket draped over my seat, and she called for the medics. Because of the horrific scene, paramedics assumed she was DOA, so they did code 1 to the scene. The medic strolls up to the driver's side, and my mom says boo. She tells me the practically guy crap his pants, then hurried to set her free. After cutting through the wreckage, they got her to the local hospital, then life flighted her to the bigger one. She had a broken femur, lots of cuts from the glass, broken left arm, 2 or 3 ribs, hip, knee, and ankle, plus internal bleeding that seemed to disappear once they arrived at the hospital. Turns out she received at B, which she still suffers from 19 years later. The most significant part of the recovery, however, was raising a special needs child and a son by herself. My father left her because of the accident, and no one else would help her. She couldn't do physical therapy or even get treatment for hurt B because of it. Spinal orthopedic engineer here. A small set of patients whose disc degenerates to a grade 4 spondylolisthesis in a very fast span of time, such as a trauma case, can become either paralyzed or partially paralyzed in their lower body. A 2-hour surgery involving a spinal interbody and posterior fixation can under most circumstances have a patient walking the same day, although that never happens due to safety precautions such as having them rest a day or two to allow muscle soreness to fade. Had an elderly patient who presented with a severe kidney infection condition called emphysematous pyelonephritis. Normally we would take her to the operating room and perform an emergency nephrectomy or removal of her kidney. However, she was unresponsive and hemodynamically unstable and was deemed too unhealthy to undergo a big surgery. As a last resort, we placed a drain tube into her kidney to give the bacteria a way out. She didn't improve much after this. She was never really alert or had energy to get out of bed. She was eventually discharged to a nursing home on palliative care. A month later, I saw her in clinic, and she was P. She was completely coherent and furious about the nursing home. Apparently one of the other residents was bullying her and ruining a card game she liked to play. We admitted her to the hospital that day and did her nephrectomy. She had one of the fastest recoveries ever seen after a nephrectomy, and she was in her 80s. Incredible recovery from where she started. In a messed up way, that jerk in the crappy nursing home saved her life by gave her motivation to get better. In April of 2014, my husband was diagnosed with ALS at the Mayo in Rochester after what we thought was a simple visit to be tested for knee replacement. We were shocked, as you might imagine. There is no cure for ALS and average life expectancy after diagnosis is 3 years. In July, he retired from his job as a writer-director at a global reinsurance company. As a Christian family, we prayed and we believed he would be healed. Every 3 months he returned to the Mayo for tests to see how the disease was progressing. It never got any worse. In January of 2015, he asked his company if he could return to work because he didn't appear to be on the way to death and we weren't in a place financially for him to retire. They had not been able to replace him and were happy to have him back. In April of 2015, the doctors at the Mayo undiagnosed his ALS. In August of 2015, he had surgery at the Mayo to relieve an impinged nerve in his spinal cord. This sounds much simpler than it actually was. It was hoped that over time this would allow his body to heal and correct the foot drop he was suffering that brought him there in the first place. They said this could take a couple of years as the nerves heal extremely slowly. His feet and ankles were checked by a nurse about 6 hours after surgery and all normal strength had returned. All the doc could say was this is very unusual. He is very much alive and still working and has a great story to tell. He calls it his year of living dangerously. This isn't a recovery. He was clearly misdiagnosed. You don't just recover from ALS. It's a death sentence. The only uncertainty is how long the degeneration will take before it kills you. Diabetic with Fournier's gangrene. Do a quick Google image search. Had to be debrided and was basically flayed from mid-thigh to the pubic area, down to the muscle. Surgeon did a stellar job on debridement and the patient, albeit had a very long inpatient stay, had all things considered a pretty incredible recovery. Not doing the Google image search. This is a long comment TLDR. At the end, we had this few hours old newborn transferred into our ward. She had her older sister die at the age of 11 days without any diagnosis. A metabolic disorder was suspected but not proven. We feared that she didn't have much time to live if we didn't diagnose and treat her ASAP. Her mother was traumatized to the point of refusing to name her. She thought that if she lost her without naming her, that it will hurt less. I was a part of the team that took care of this case. I spent a lot of time with both the newborn and her mother. I managed to convince the mother to name her. She gave me a couple of names she had in mind and I chose one. Both of them were the first people I would check on when coming in and the last to see right before going home. Finally, the team managed to diagnose her phenylketonuria deficiency. The treatment was dietary. She had to avoid consuming the phenylalanine amino acid. She got better. A year later she came in for a checkup and a couple of dietary touch-ups. She was the most beautiful 1-year-old girl I have ever seen. I wanted to smother her with kisses and hugs. And I'm someone who's not usually a fan of kids. When I first saw them, her mother looked at her and said, "That's Uncle Sam. He's the one who named you. He played a huge role in saving your life. Give him a big kiss and warm hug." That almost brought me to tears. She was a healthy and energetic little angel. The best part of my medical career so far. P.S. To be totally transparent, the disease she had is kind of common and not a hard diagnosis to find. And the prognostic is a good one, if treated early. One last thing. I played a small role in the medical investigation, but the difference between the day we got her in the ward and a year later is unbelievable. TLDR. A mother refused to name her newborn because she thought she, the newborn, would end up dying. I named her, played some role in taking care of her. A year later she came in for a checkup and she was the healthiest 1-year-old. Frick me, it's got dusty in here all of a sudden. Honest. Another not a doctor comment, but a friend of mine was a pretty bad alcoholic with a weak heart. He was 40 years old, tried to quit drinking cold turkey, and his second day without a drink he started having seizures, so his wife took him to the hospital. That night he decided he didn't want to be in the hospital and tried to leave. He was getting violent, so the doctors and nurses sedated him and put him into a medically induced coma. During the coma all of his organs except for his kidneys went into failure. He was being kept alive by machines and medications in the ICU for 3 weeks. Nobody expected him to live. The doctors said he was the sickest person in the hospital and didn't expect him to live, but miracles happen. He slowly started getting better over his stay in the ICU and the doctors did a tracheostomy, breathing tube in his throat, different than a tracheotomy, as a last-ditch effort to take out his feeding and breathing tubes to try to wake him up. It took a week just to wake him up from the coma. After a few more weeks of PT and at least a month in a rehab facility, he is currently fully recovered and getting back to a normal life. From what every single doctor and nurse that worked on him said, that his recovery would be described as mind-blowing. Also, the doctors and nurses at Valley Hospital in Ridgewood, NJ are the best in the world and deserve all the thanks in the world for the work they do every day. TLDR. My alcoholic friend went into organ failure from quitting drinking and recovered after being in a coma for 3 weeks. This does raise a good point as well. If you're an alcoholic quitting drinking, go see a doctor. The withdrawal symptoms from quitting cold turkey are well known to be potentially lethal. Better to get medical advice and do it safely. Doctor, MD. Here, I have a patient who is in her 20s who was a micro-preemie born at 24 weeks gestation. That is just at the cusp of viability and can have debilitating consequences or, very commonly, ultimately death as a newborn. She tells me at birth they gave her mother the option of palliative care for her, allowing her to pass naturally, or fighting for her life. Mother chose the latter. Somehow she beat the odds, has no noticeable deficits and got accepted to a prestigious university. I would say that is a pretty good recovery. Not the doctor but the catalyst. My grandmother had a tumor that was apparently unreachable, just behind her ribs. I did not know this, and went to snuggle with her for a while because she was generally just very nice to be around. However, while repositioning myself, I elbowed her in the ribs, right where the tumor was. Now, keep in mind, again, I'm like 9. I don't know anything. All I knew at the time was that I elbowed grandma and she shouted in pain. My mother and grandma both comfort me while I cry over this. A few days later, grandma goes to the doctor again, and it turns out the tumor had been dislodged to the point where they could remove it. She kept kicking for a few more years after this, and I like to think that I helped. A kid who had a 3% chance of survival with surgery and still survived for 2 years and lives to this day. I'm the patient. I went through 10 surgeries in 800 days from 2015 through 2018. Bone spur to amputation. 2 bone biopsies in 3 days. 2 separate ankle fusions. Avascular necrosis and osteomyelitis. 18 inches PICC line for 10 weeks. Then I became an LBK amputee on the 19th of April 2018. Received my first prosthetic on the 18th of June 2018. On the 6th of November 2019 I squatted 607 pounds and leg pressed 1005 pounds. Within a year of being blessed with the ability to walk again I am squatting more than most 2-footed beings. I'm just stoked on it and felt this question was a dope place to put it. Keep crushing the recoveries my medical misfits. Man in his 30s was brought into my intensive care unit having drowned in a lake for roughly 30 minutes before being pulled out by friends and emergency services. His core temperature was 29 Celsius, but the paramedics had managed to restart his heart on the way to the hospital. I wasn't holding out much hope for this guy. 30 minutes underwater usually means either death or permanent brain damage. We put tubes into every orifice and created a few more for good measure. He was hooked up to a ventilator, hemofiltration unit and placed on a warming pad. Over the next 24 hours we slowly warmed him back to normal temperature. Once his vitals were quite stable, we held off on his sedation and slowly woke him up while I was off shift. By the time I was back in 12 hours later, he was sitting up having a cup of tea. I walked past him that morning. He looked at me, and I looked at him. I felt like I'd seen a ghost. When he saw that look on my face he started to cry. One of the few times I've ever hugged a patient. He walked out 2 days later, and 5 days after the incident which by all accounts should have meant his death. I will never forget him. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.